Okay, we are live, we are recording, and let's go back over.
Okay. We have 303 now.
Can you hit do all attendees? I do not believe so.
I think we're gonna need to go up. I don't know what's going up there, because Dottie K is the first thing.
Can you promote Paul Mikma?
Our apologies for the delays, everyone. We're just trying to overcome a quick technical difficulty. We got Alder Meekma who's just joined. Welcome, Jason.
I think it might be Shannon, but give me 1 second. Okay. Can you please promote, make a panel?
You sure he's not at his desk?
Yep, he just confirmed he's in 303.
Is room 303 available?
Yeah, can you hear us?
Yep, we can hear you. Great. Thanks, everyone, for joining us this evening, the hour of 7 o'clock, having arrived on this 5th of August, 2020, a Wednesday. I will now call to order the City of Racine Common Council. The first order of business is to ask everyone to stand, if you are able, and to face the east and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone, for being here this evening. Just want to find Mr. Tate. Let me put it on the top. Alder Tate, do you know of any absences for this evening?
Yes, Alder West and Alder Coe have asked to be excused.
Thank you very much. Duly noted. We will now move on to the next item of business, which is the approval of the Journal of Council proceedings or the minutes for the 21st of July, 2020. At this time, I would entertain a motion to, we'll just do it by acclamation. All those in favor of approving the minutes of the 21st of July, please say aye.
Aye. Aye.
Opposed? That motion carries. Know of any absences for this evening?
Yes, Alder West and Alder Coe have asked to be excused.
Okay, moving back on, and just so people know, I've muted everybody just to avoid some of the feedback that we're getting here. Please remember to raise your hand as we move through this. The first item we have on the agenda is the Safer of Racine presentation by Public Health Administrator Dottie K. Bowersox, who I believe is in room 303. Dottie K., if you could wave so people can see you. Excellent. We're going to unmute you, and then if people could give us just a couple of seconds to bring up her PowerPoint presentation. And then just so people are prepared, what we'll do after Dottie K's presentation, once we move into the committee reports, we will actually do the mayor's report first, which has the items that Dottie K. Bowersox will be addressing here in case there's questions while we're going through that. So with that, I will ask Dottie K. Bowersox if you could make yourself available and unmute yourself, and then I am going to share a document with...
Yep, share at the top left. Application, PowerPoint.
Okay.
Tara, are you ready?
Where?
1 second, please.
Okay, sure, thank you.
There we go. Okay, now we're ready. And when you want us to advance the slide, just go ahead and say so.
Okay, thank you. All right, good evening, everyone. Delighted to be here again. I have Cody Pierce with me, who is the Public Health Department epidemiologist, and I have Bobby Fergus here with me, who is the Community Health Director. And special thanks goes out to Stephen Curtis, who helped with this presentation, put it together for us so that we can outline what's happening at the national level, at the state level, and then at the local level. Tara, next slide. Thank you. So at the national level, we've got 4.75 million confirmed cases in the United States. 7-day rolling average is up 8.5%. Previously, the surging states, Texas, Florida, Arizona, are leveling off, which is a really good thing. But the U.S. is still in an acceleration mode and still averaging about 59,000 new cases daily. The cases are leveling off due to mask mandates, business closures, and reinstatement lockdown of travel restrictions. One of the latest ones is from the city of Chicago, restricting those individuals that are visiting, traveling to Wisconsin for a 14-day quarantine. Migration of cases, count increases from the south to Midwest. We've seen this previously, south to the west to the Midwest. And the outbreaks are associated with bars, gyms, church gatherings, social and family gatherings, group settings, and youth sports. The underlined items here in this bullet point are what we're seeing in the city of Racine. Bars, which would include restaurants, gyms, social family gatherings, or barbecues, birthday parties, and group settings, same thing, and youth sports. And we're finding that as well as at the national level, there's an inconsistent mask use, and traveling to hotspots are contributing to the outbreaks. Tara? This shows us the national trends for COVID, the 7-day averages. As you can see, the United States, we've been again in the acceleration mode. In the last couple of weeks, we've seen a downturn in the number of cases across the country. At the same point, if you look down on the right-hand side and you look at India, which again has been accelerating, but not at the pace that we have been, they have 1.3 billion people in India. And so if you look at a comparison between the two, again, the United States has had much more activity with COVID than across the world. Tara? Again, national trends, new cases in the last 7 days. Wisconsin is now number 19 in the U.S. for the number of cases in the surge. If you notice in the top 10, Illinois, for the first time, has made the top 10. And in particular, we're concerned about that because obviously we share a border with them, and there's a lot of transportation, a lot of activity between that state and the state of Wisconsin. And again, if you take a look at Montana, Wyoming, Maine, New Hampshire, a lot of those states that are still having less COVID activity, a lot of that is reported due to the fact that they have 1 or 2 larger urban areas within those states, and a lot of that is tourism related. So again, they're not seeing as much activity as the rest of the country. And if you notice, California, Texas, Florida, as I've mentioned, are hotspots. California has about 25% of the nation's population. So that to some degree would be anticipated. All right, Tara? Now for the state of Wisconsin. Statewide totals confirmed cases, a little over 56, almost 57,000. New cases are averaging about 842 per day over the last 7 days. Today we saw 884 cases that were confirmed positive. 92% of Wisconsin's 72 counties are categorized as having high activity levels. So Racine County is number 2 with the case rate, 1,711 per the 100,000 people. The city of Racine, or the jurisdiction of Racine, is at 2,450 per 100K people. So again, the city of Racine is carrying the load, shall I say, the caseload of the COVID cases for the county. On August 1st, we had the emergency order mandating statewide face mask coverings by Governor Evers. The face masks needed to curb significant increases in cases across the state, again, because we are seeing a surge. And the Racine ordinance applies where it is more restrictive than the state order. And that's been identified, and City Attorney Letney has sent out several emails concerning that and itemizing that for us. Tara? Wisconsin COVID-19 trends, again, this is in Wisconsin, in comparison to the Midwest region. We're seeing an increase. Illinois, again, seeing significant increases. We're also concerned about Missouri and Ohio at this point. Wisconsin is the dark blue dot, about middle of the, on the right-hand side. But again, we're concerned about Illinois because we do share a border. We are seeing some increases in Minnesota as well. But Wisconsin, Michigan, Minnesota, we're staying pretty close together at this point. Tara? And then again, this just gives you an illustration on where in the state of Wisconsin we're seeing increases. Obviously, Milwaukee County. Then we've got Racine County. These are the top 10, Brown, Kenosha, Iron, Walworth. Again, all of those listed there are the top 10. And the color, the darker color indicates more activity, lighter color indicates less activity. And then we've identified each one of those counties for you and the location for them. Tara? All right, and I'm going to turn it over to Cody. Again, Cody's the epidemiologist for the city of Racine.
All right, so just a quick update on where the city's jurisdiction sits right now as of this afternoon. As of this afternoon, about 2 o'clock, we had 1,951 total positive cases in our jurisdiction. Of those, about 18% or 358 people are currently infected with COVID that we know of. Another 1,562, or about 80% of our total positives, have recovered, and about 1.6% or 31 individuals have died so far of COVID. Overall, we've had just over 20,000 tests conducted on City of Racine residents. 18,493 of those have come back negative. So, Tara? So this kind of gives you a perspective of how cases have fluctuated throughout the course of the pandemic and a timeline of different events throughout the pandemic. So you can see that our jurisdiction got its first case in mid to late March. Shortly after that, the Safer at Home order was enacted, and then it was extended in the middle of April. Cases grew pretty rapidly in our jurisdiction from about mid-April through early June, and then began to sort of level off. At that time was when the Supreme Court's decision came down and Safer at Home Racine was put in place, and then Forward Racine was put in place, and all of those things kind of helped to bring our case increase to, slowed it down essentially. Safer Racine, as you know, enacted the middle of June, continuing to keep our caseload lower. And then cases began to increase about 2 weeks after the 4th of July, which was something that we expected with an increase in gatherings and parties and things like that. And then the mask ordinance coming into play toward the end of July. So.
Yeah, and for the mask ordinance, as well as for the state, it's going to take a couple of weeks to understand or to really feel the effects, the positive effects of the local ordinance as well as the state ordinance.
Next slide, thank you. So this graph shows a few different things. The darker blue line there that goes up and down and gives the percent, that is our daily percentage of positive tests. So that's something you've probably heard a lot about. It fluctuates a bit, but the orange line that is in there, that gives our 5-day rolling average of positive tests. So for any point, it gives the 5-day average of positive tests, and it kind of helps to rule out any outliers or sudden increases or decreases from day to day. And it shows that we've been holding pretty steady between about 7 and 8% of our daily reported tests are coming back positive at this point. It's definitely higher than we would like to see. We would like to see lower, of course, around 2% would be the goal, even lower than that if possible. But this is higher than we were seeing as of about a month and a half ago in mid to early June. So things have increased, but as of late, they're holding steady. Next slide. All right, and this just gives you a quick perspective of how we fare compared to the rest of Racine County and to the jurisdiction covered by the Central Racine County Health Department. So the lightest line, the one that's on top from the bulk of the graph there, that is for the City Health Department's jurisdiction. You can see that we had a pretty dramatic increase in cases mid-May again through early June, tapering down toward the end of June, early July, and then increasing along with the rest of the county up to the present day.
Good, Tara. And now Bobby Fergus, who's the Director of Community Health, has a few slides to speak to.
Just providing you with a public health status update. So as we've talked about, our cases are increasing. They are becoming less manageable than they have before. We had additional help from the fire department as well as police and the library. As the community and businesses begin to open, those staff had to go back to their respective departments. So we have had few cases in the last weekend, but within the last week, we've had 124 new positive cases. National Guard testing is something that is attributing to that because we are testing more individuals. We are finding that it is prevalent in our community. Like Cody had said before, new cases can be related to the 4th of July, social gatherings, family get-togethers. You know, we are in the process of receiving additional funding for a COVID response, adding additional contact tracing staff beginning Monday, August 10th. So they will help assist us with our contact tracing, notifying our positive cases, and obtaining those close contacts of those positives to help us reduce the spread of the COVID throughout the community. Tara?
Go ahead.
I'm sorry, back one slide.
Tara, go back one slide, please. Yeah, there you go.
Sorry about that. So continuing with the status of the public health, we implemented the mask ordinance the city did on July 27th. As Debbie Kay had mentioned, assessing the potential impact will take about 3 to 4 weeks due to the incubation period of the infection, as well as the recent state mask order. Sorry, and as I had talked about before, the funding. We will see if the increase in contact tracing staff will help us reduce our cases and help mitigate the spread of COVID.
One of the important points that we want to make with this is that we've gone from 70% of carrying the load of the county of positive COVID cases down to 58%. So the Safer at Racine is working, the Forward Racine is working because, again, we've gone from 70% down to 58%, which is a significant decrease. Go ahead, Tara. All right, the Safer Racine. The information we've provided thus far gives you a picture of the national, a picture of the state, a picture of the local. These are the recommendations that we're making at this point to Safer Racine to move us into phase 3. We've got restrictions will be eased in 6 categories, the K through 12 schools, the post-secondary education, swimming pools that are licensed, indoor places of arts and culture, and indoor-outdoor mass gathering in public venues. Again, we base these recommendations as we have previously, looking at the data, looking at the information that we get from the WHO, the CDC, and DHS. We also look at other jurisdictions, but again, focusing on our numbers and looking at our charts over the last 7 days, over the last 14 days, and over the length of this pandemic that we've been involved with. We've been using good judgment, we've been fair, and again, it's based on the information that we've been provided and that we can glean. Tara? Phase 3 changes. So the K through 12, distance or virtual learning strongly recommended. In-person instruction permitted, reviewing the reopening plan with the City of Racine Public Health Department. So we're asking each one of the schools to let us know what they would like to do, how they'd like to do it, and when they're going to do it within a plan, a written plan that we can review based on an evaluation criteria to assist them. So this interaction is nothing new. We've been dealing with the schools for months now, having conversation about how to do it, what they should do, working with them on the Schools Institute recommendations. Department of Health Services is supposed to release additional recommendations early next week. But again, Cody and Bobby have been responsible on answering their questions and interacting with them to figure out what is the best for each one of the schools. The post-secondary education, those would be the gateways, for example, open following the CDC guidelines. Increasing capacity of swimming pools from 25 to 50%. Indoor places of arts and culture, increasing that capacity from 50 to 75%. And then indoor-outdoor mass gatherings and public venues. These are the venues, or these are the opportunities that individuals would engage that will require either licensing or permitting from the city. They will be required to come up with a plan. So if you're going to have a block party, if you want something on Monument Square, if you want to be at a park, these are the restrictions. 100 individuals would be the max, 50% in-core capacity based on the occupancy permit, but they will have to maintain the 6-foot distancing. So they will have to show us how they're going to do that. So if you're going to have an event down at Monument Square, how many people can fit within that perimeters, again, keeping those distancing, and how you're going to maintain the distancing during whatever that activity is. Tara? So why keep Safer Racine? As you can see from the illustrations that we provided, that when we do these things, we have a decrease in the number of positive cases. Again, Bobby has mentioned that as the cases increase, it becomes less manageable for us. So if we look at other states, they are reinstituting restrictions to target the outbreaks. They're looking at putting additional controls in, so again, they can control the spread of the disease. We've got variable testing capacity due to national regional testing needs. So again, the City of Racine, our jurisdiction, we've done a great job with offering testing availability through the National Guard and through Ascension and through Advocate Aurora, much more so than many of the jurisdictions around us. And we've got testing that was going on earlier this week. At the same point, the federal government is no longer picking up 100% of the testing. They're asking states to pick up 25% of that cost. And we've been seeing a shortage in test kits. So across the country, they've been using supplies up down south with their surges. And so for our testing this week, we got 500 less tests than we had requested because of that shortage. Tara? The mask ordinances, thank you very much for that. The one that we have locally, as well as thank you to Governor Evers and his staff for the one at the state level. But the masks and the proper utilization of them can reduce the risk between 60 and 80%. So when we adopted our jurisdiction's mask ordinance, there's all kinds of documentation that came out prior to that, just shortly prior to that, that demonstrates that masks make a difference. This is a respiratory disease. Touch points are very important, sanitation, hand sanitation, sanitation of different surfaces, but again, it's a respiratory disease. So the masks are very important at this point, and we found that, and we've seen that across the country. Enforcement is challenging and non-compliance is present, which we understood that was also going to happen. But at the same point, we're finding that a lot of individuals are picking up masks, are utilizing masks, and they're doing well with it. Complacency and disinterest in protective measures. I've turned it the COVID fatigue. You know, there's less interest in social distancing and respiratory etiquette. Again, that's why over the 4th of July, we could see that increase. We also increased testing, but at the same point that describes or that identifies the prevalence of disease in the community. And there's that increased desire to engage in large and social gatherings. Again, as I mentioned, we're seeing the birthday parties, the backyard barbecues, the family get-togethers, the graduation parties. Those are the things that we're seeing with the increase in the number of positives that we're receiving. Tara? So the ordinance reduces the number of potential people exposed, which is significant. It conserves limited public resources, which again, we have a small department for 78,000 people that we're responsible for. It allows emergency services to respond to other emergencies, incidents, and events, particularly law enforcement and fire, and it minimizes the impact of local healthcare systems, which for us in the city obviously is essential. All of these services need to be maintained, and if we get overrun again with COVID, there's concerns about each one of them and our response times and our availability to respond comprehensively. So, and we know this works. So again, we've gone from 70% down to 58% of carrying the positive load within the county because of the measures that we've enacted. So I'm very proud of what we've done and how we do it. And as we've mentioned, we've got additional staff. On the agenda tonight is the approval of contracts that the state of Wisconsin has awarded to us for additional staff. Those individuals will be starting next week to assist us and to help us out. We've been very grateful for the fire department and police department, as Bobby has mentioned, for their assistance. At the same point, with all of this, we need to maintain our emergency services, our public health services, as well as our hospital services. And thus far, we've been very fortunate on multiple levels. But again, I believe it's because of the interactions and the activities that we've done to this point. So that concludes our presentation. We're delighted to take questions at this time.
Okay, everyone, I'm just going to turn off the presentation, and then as Dottie Kay said, willingness to ponder questions. If people could virtually raise their hands if they'd like to ask a question. We will start with Alder Lemke.
Yeah, I didn't have a question. I would just like to make a comment that I really appreciate seeing the policies and the case rates after the policies. That's very helpful, and I thank you for putting together all that data in such a comprehensive presentation. I appreciate it.
Oh, thank you, Alder.
Thank you very much for that. Alder Tate.
Thank you, Mr. Mayor. Again, thank you to Director Bowersox for her and her team's efforts to try and keep our community safe. I had a few questions as far as specific details relating to the numbers and some of the things that were mentioned. I did note in one of the earlier slides when you talked about underlying things that were contributing to spread in the city of Racine, that churches were not underlying, or church gatherings were not underlying. I think most of us, who either attend or have other people who regularly would attend, know that that's one of the few standing entities that has really transformed their response and how they provide their service by meeting virtually. And I'm wondering if you might be able to speak to kind of what some entities have done to mitigate the spread and how they haven't become hotspots as opposed to others.
Oh, thank you, Alder. Yes. Yeah, thank you, Mayor. Yes, and again, you're absolutely correct. The churches have done a phenomenal job with making sure that they're doing virtually, or they're in small groups, or they're masked. And many of the other facilities have been doing the same sort of thing. The restaurants, the bars, for example, we're seeing some increase just for the fact of the rotation of individuals through the facility. They're masking their staff. They're asking their patrons to wear a mask. There's social distancing or physical distancing of those individuals that are sitting at the tables. They're keeping the families together and making sure that those families are, again, that 6-foot distance away from other individuals. We're also seeing that a lot of things have been canceled. So, summer is always a big time for us, and it's a viable time for us. But we're seeing a lot of those activities, not only in the city of Racine, but across the country, that have been canceled. Concerts, activities down at the beach, and that, again, has confined and lowered our numbers for us.
Okay, great, thank you. So I think Cody was mentioning about the number of tests that have been accomplished, or at least conducted. I'm wondering, have we kept data of how many of those tests are unique to individuals, or how many specific individuals have been tested? How many of the tests that we have conducted are of potentially repeat tests, and does that include the National Guard data that comes in waves?
Yeah, thank you for the question. So that is data that we could certainly get for you. I don't have that on hand right now, but
Okay.
it is definitely attainable, and it would include the National Guard data.
Okay. So it would be possible to distinguish, how many of the tests we've conducted are repeat tests?
Yes, yeah,
Okay.
and just to be clear, so the positive tests are, of course, all unique individuals.
Right.
The negatives are repeats of some people. So.
Okay, great. I think that would be useful data because, I know I've been tested several times. Fortunately, to come back negative, but I just want to know. I think it's important to indicate, when we have a number of negative tests, that could be people who are going back who may potentially been exposed and getting it tested again. And I think it's important to note that when we talk about the numbers that we're seeing. So thank you.
Sure. Thank you. Alder Glenn.
Thank you, and thank you for that presentation. I just have two questions, and one of my concerns is the shortage of tests because of more testing going on around the United States. The tests that we do get from the state, are we putting in place to get? Should these tests run out, to get tests from outside vendors?
Dottie Kay?
Yes, thank you, Mary, and thank you, Alder. At this point, the way the distribution of the tests are and the funneling of the tests, they're going through the state. So we have a minimal amount that they actually provide to us, but to try to offset the lack of supplies and such, we're working very closely with Ascension. Obviously, we've got several sites here in town that they are testing, but we're really pretty much at the mercy of the distribution, the manufacturing, the distribution of the supplies for those tests. Now, we saw the same sort of activity early on with COVID, and again, we're seeing that same sort of activity now with the limitations because we haven't been able to build up a stockpile nationally of those supplies.
Does the city plan on going out on their own and getting test kits for COVID-19?
Well, the test kits, oh, thank you, Mayor. The test kits aren't available. The supplies for that aren't available. So, and that's why across the country we're seeing they can't manufacture and distribute them quick enough to meet the needs.
Okay, and then I just have one more question on there. You talked about the number of people that should be gathering at city properties, city venues. What about pop-up, or not even, what are the restrictions per se for like a rally, a protest, or a march? Is the city health department either or have anything put together for that? Are they illegal to do, or what? I don't understand that one.
Dottie Kay?
Oh, thank you, Mary, and thank you, Alder. The mass gathering, the maximum amount of individuals is 100.
So no matter what, whether it's on a city venue or someone decides, just a bunch of people decide to get together, there could be no more than 100 people.
That'd be correct.
Okay, and then what would, I'm not sure if you could answer this, or maybe if the mayor or the city attorney could answer this, what would be the consequences if there's more than 100 people together?
I don't know if Dottie Kay wants to address that, or if Attorney Letney would like to get to that piece of it.
Well, the Safer Racine ordinance, citations can be written for people that violate the Safer Racine ordinance, and there's a provision for that the council put in place. So that's at least possible. Remember, it's people that aren't socially distancing outside. The city's specific provisions relate to, for public venues, events that require city approval or permits. So if, for example, there was a protest, a demonstration that walked down the street, that's not necessarily something that requires a city permit or approval. There is, dry throat. There is no intent to enforce this against people who are exercising their constitutional rights to protest if that's what they desire to do. So that would just depend on the circumstances and people that aren't properly socially distancing. And of course, we have the mask ordinance that requires people outside, if they are within 6 feet of each other, they have to wear a mask. So that would be part of it too.
Okay. Okay. Thank you. Thank you for that. I'm done.
Thank you. Alder Perez.
Thank you, Your Honor. Dottie, I have a question for you. I spoke to some people who work in the medical field, and they were under the impression that if someone has COVID today and they test them tomorrow and they still have COVID, that's registered as a COVID case, like an additional COVID case. Are they misunderstanding the process, or is that what's happening? Do you know?
Dottie K. Bowersox, can you explain the process?
Oh, thank you. Mayor and Alder, I'll have Cody Pierce respond to that.
Yes. So the system that we use that's provided by the state of Wisconsin to manage all of these cases, it's an electronic system online that we use, and as the lab results are reported to us by the labs that conduct these tests, positives and negatives are both reported to us, of course. And so if we see a positive result come in, we can see past lab results and past, health history of these individuals who are coming into the system. And so we can see that they've already tested positive. So that lab result is essentially just attached to their previous case, and it would not be counted as a new case.
Okay, thank you.
Thank you. Alder Peterson.
Yes, thank you, and thank you, Administrator Bowersox, for your presentation. In regards to the maximum healthcare services, will that be, I've heard different variations of who's going to be doing that. Are they going to be hiring anybody local, or is that strictly out-of-town contractor?
Patty K., can you talk about the contact tracing?
Sure, yes. And no, we're, the individuals would be, are individuals that need to be here at the health department. They will not be off-site. We are using a contract agency, and we have requested local individuals.
A little confused there. So will you be hiring, or will they be bringing people down, or how does it work?
We would not be, thank you, Mayor. We would not be hiring them as employees of the city of Racine. They would be hired as contractors through the contracting agency. They would be considered temporary employees or temporary contracted individuals.
Okay, thank you very much. And as far as the contact tracing, I know it's been an issue from day one due to lack of manpower in your office and extending through the different departments to help you out. Has the county offered you assistance at all in this?
Patty K.?
Oh, thank you. Specifically for contract tracing, no. So the county does not have, the other health department within the county of Racine is an independent health department. They're not a county health department. Now, we've had mutual aid between the other health department and this health department on both ways when we've had an increase in cases. But the county itself has not offered to do contact tracing. But Central Racine, we've had mutual aid.
Thank you very much. Thank you again for your presentation.
Thank you, Alder Peterson. Alder Horton.
And Dottie K., thank you guys for the presentation. I just have one question, just a follow-up from Alder Peterson question. And I know we are hiring, we're going to have an outside contractor doing this contact tracing. Will there be any residents, like Racine residents that would have an opportunity to get some type of part-time employment in doing that?
Yes, yes. And what happens for this is with the agency that we're contracting with and who is finding these individuals for us, yes, we've asked them to be a priority for city residents.
Alder Horton, anything else?
No.
Okay, great. Any other questions from alders for Dottie K. Bowersox or Cody Pierce or Bobby Fergus on these items? Okay, seeing none, then I will, oh, sorry, Alder Peterson has his hand raised one more time.
Sorry about that. I
No,
did not
that's okay,
see in
go
there,
ahead.
I did not see in there the hospital load and how the hospital's doing at this time. I've read in the newspaper that they've downsized their COVID units. Do you have an update on how the hospitals are doing at this time?
Dottie K?
Yes, I can. At this point, with Ascension and Advocate, you are correct. They have reduced the number of beds available for COVID-19 patients, and they are doing well with those individuals that they currently have.
Thank you very much.
Thank you, Alder Peterson. And then Dottie K and Bobby Fergus and Cody Pierce, just again, thank you for the heroic work that your department and others have done to really navigate the city and its community members through a really historic and difficult time. So thank you for that. While the health department is still here, I'm going to move us ahead to the bottom of page 8 on your agenda, so we can take up the Safer Racine and COVID-related items up in case there are questions that come up during the discussion that they might be able to answer. So with that, Alder Tate, well, I'm assuming there's going to be items here for separate consideration, but nonetheless, under the Office of the Mayor report, have you received any requests for separate consideration?
I have. I received requests for item 0507-20 and 0518-20, neither of which are the public health, or at least related to our public health administrative staff.
Okay. Is there anyone who would like separate consideration on the public health related matters? Looking for a virtual hand there. If not, we will put those items on the consent agenda. Alder Tate, if you could read the items that you have received requests for separate consideration.
All right. So first I'll read the items that are going to go on the consent agenda, and then we can go into the ones and have the discussion about the other ones. So if the mayor would so choose, if the chair would so allow.
Please proceed.
All right. So first item is 0505-20, communication sponsored by Mayor Mason submitting Municipal Judge Weber's deposit schedule for citations written for violations of Racine Ordinances Section 54-35, wear of face coverings. Recommendations that the schedule be approved. There's no additional fiscal effect. Item 0506-20, communication from Mayor Mason requesting to adopt ordinance 0007-20, Safer Racine 2019 novel coronavirus response extension. Recommendation is to adopt the ordinance as presented. And then the last non-separate consideration item is 0511-20, appointing Charles Helm to the CDBG Advisory Board with a term expiring May 31st, 2023, and Liz DeBilzen to the CDBG Advisory Board with a term expiring May 31st, 2023. Without objection.
Alder Glenn.
Yes, I'm sorry, I know what I was doing, but anyhow, I would like to pull out 0505-20 for separate consideration.
Okay, we will take that up at this time. Alder
Item
Tate read the item already.
Yep, item 0505-20, move to adopt.
Motion to approve the item. Is there a second? Second from Alder Taft. Alder Tate, do you want to speak to the item?
No, I mean, this is, well, fine. This is standard practice when an ordinance is put into effect that has financial penalties associated. There is the requirement of the judge to provide the fee schedule, and this is kind of the process thereof. So,
Alder Glenn.
Thank you. As for standard practice, shouldn't this have come before the Public Safety and Licensing Committee as we do for all other fees, fines that go through the municipal court?
I'll have Alder Letney answer your question.
attorney.
Oh, sorry, Attorney Letney. Apologies. Thank you, Alder Tate.
Thank you, Mr. Mayor. It certainly could, and that would be an ordinary process. There is a history of things being referred directly to the Common Council. This, of course, is an ordinance that has been in effect since July 7th without a specific bond schedule attached to it. The judge had to wait to see if the council was going to pass the ordinance before he could put together the bond schedule. So this just gets this piece of that ordinance into place right away.
Okay, but this is just kind of what happened with the marijuana 25 grams or less thing. It did have to come through public safety and licensings. And at this point, I'd like to make a motion to send it back to PSL so we can fully vet on this one.
So Alder Glenn has a motion to refer this item 0505-20 to public safety and licensing. Is there a second for that motion? You want to wave their hand if they, okay, that motion fails for lack of a second. Is there any other discussion on the motion? Anybody else who would like to speak to the motion? Seeing none, the clerk, I'm going to open the roll. When the clerk calls your name, please vote as you wish. Alder Perez, just so you know, you are the first vote of this evening's council meeting, so we'll be calling you first this evening. This is a reminder, we rotate alphabetically from meeting to meeting who votes first.
Alder Perez?
Aye.
Alder Jones?
Aye.
Alder Tate?
Aye.
Alder Glenn?
No.
Alder Santiago?
Aye.
Alder Peterson?
Aye.
Alder Mi'kmaq? Alder Levy?
Aye.
Alder Land? Alder Land? Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
That is 12 ayes and 1 no.
Without objection, would the remaining items be able to go on the consent agenda? You're muted, Mayor Mason.
Thank you, Alder Tate. Without objection, we'll move the remaining items to the consent agenda.
All right. And
So
then
ordered. What was the next item for separate consideration, Alder Tate?
the next item would be, where are we at? Item, excuse me, 0507-20, communication from Mayor Mason requesting to extend the City of Racine declaration of emergency until December 31st, 2020. The recommendation is that the declaration of emergency be extended until December 31st, 2020. Move to adopt.
The motion to adopt this item, is there a second? Second from Alder Taft. Discussion. Alder Peterson.
Yes, is there a reason why we went with the 5-month extension versus a 2 or 3 month extension like we've done in the past? And at this time, I understand when we are operating right now, it's not a continuation. It's a new declaration, being that our old one's expired.
The old one expired at the end of last week. This is reapplying the same language. The idea was to have both of these orders, the Safer Racine and the emergency declaration, run concurrently, and the mask ordinance all running concurrently on the same timeline.
Okay. And Does the emergency declaration, does that have anything to do with all these no bid contracts that we're getting?
No.
All right, thank you very much.
Thank you. Other comments on item 0507-20, Alder Glenn?
Yeah, I was just wondering with the desk. One of my neighbors had called me. I'm looking for my sheet. They got a lot of stuff going on here. Is this gonna, if we pass this, is this gonna keep City Hall closed?
So I'll ask the city attorney to address to reiterate what the emergency order keeps in place. Attorney Letney?
So when there's an emergency declaration like this, it's really about city governmental operations. And there's some grants that may be available. And for instance, the fact that this common council is meeting virtually and that committee meetings are meeting virtually is affected by the fact that we have an emergency declaration in place. Whether city buildings are open and to what degree is affected is related to the declaration of emergency in that this allows the city to continue to operate under emergency procedures, but whether or not city buildings are open and to the degree they're open is really a separate consideration based upon public health administrator and the building manager and the mayor's decisions as to how broadly and under what procedures buildings would open. So the emergency procedures could still exist and the buildings could open at some time between now and the end of December, or they could stay closed if the health circumstances demand they stay closed.
So in other words, the ordinance about, you know, spaces being open, you know, gyms, stuff, everything else like that does not apply to City Hall. City Hall can, during this emergency, can continue to stay closed and not truly operate day by day, you know, at 100% day by day operations, dealing with just basically the general public and contractors getting permits and stuff like that.
Attorney Letney?
Well, City Hall can stay closed, but at least my experience has been with all those other issues where that sort of contact is needed, it's happened. We've found ways to deal with all those issues.
And then leading on to virtual meetings. So by passing this, we would have virtual meetings till the end of the year with basically no public comment. Is that basically what's included in this declaration of emergency, that we no longer want to hear our citizens' voices?
Attorney Letney?
Well, there was a separate order that runs concurrent with the emergency orders that permits common council members to be counted as part of the quorum, even though they appear virtually, which is contrary to the normal requirement that everybody has to physically be in the room in order to be counted for quorum. As far as access to meetings, access is still available online, and public comments are being taken in the procedure that's existed for a couple of months now since meetings went online. Whether or not there is some desire to change the way the public comment period is done, that I think is something probably to be addressed with the mayor and the city clerk.
Alder Lemke.
I just wanted to double check and flag, so for the public's knowledge, and flag for alders that we get public comment sent to us before every meeting, or at least I do. I don't know if maybe there's a spam folder issue or something.
Yeah, if I could just ask the city clerk, I appreciate the clarification, Alder Lemke. If I could ask the city clerk just to remind people what that procedure has been.
So there is listed on the bottom of every agenda that public comments should be emailed to the city clerk's office. We ask that it be sent to clerks with an S at cityofracine.org by at least 4 p.m. the day of the council meeting so that we can send it out to the alders, hopefully with time to read through them all.
Thank you for that. Alder Perez.
Thank you, Your Honor. I'm just kind of curious, if we continue this declaration of emergency, what kind of economic impact will that have on our budget going forward? And would we be receiving state or federal grants because we're in an emergency declaration? Could you advise us on that, please?
Yeah, I'm going to ask Kathleen Fisher if she is available to answer that. Kathleen, are you unmuted?
Can you hear me now?
We can.
Okay. So the city of Racine has received several funding sources of grants specific to COVID-19, the majority of which has gone to the health department, went through finance and personnel last week and is probably on your agenda tonight, dealing with contact tracing. We also got some routes for recovery money. There is potential that we will get more funding going forward, but I haven't heard anything specific yet associated with that.
Alder Peterson.
Yes, follow up on the public comments. I have gotten the public comments. I was wondering, generally when somebody speaks at a meeting, they give their name, their address, et cetera, et cetera. Would it be possible in the future for that to be added to the public comments that are sent out to us, please, so I know who's speaking to us, be it a resident, a non-resident, constituent, non-constituent?
It's an excellent point, Alder Peterson. I will refer your question to the clerk.
Just for clarification, are you looking to only be sent public comments that meet the typical standard requirements as they would in person?
Correct. Just, I mean, generally when they stand in front of the common council, they have to give their name and their address, and then they state their point.
Okay, so just as long as they meet all of the typical requirements, then send them, but if they don't meet those requirements, they would not be sent, correct?
I'm just looking for a name and an address attached to the public comments.
Okay. Thank you.
Thank you,
Thank
Alder
you very
Peterson. Alder Land.
Yes, I'm just wondering if it's possible if we have the public comments read before the start of the meeting, maybe then everybody would feel like they were heard.
Do you want to speak to how many? I think that's something we could consider, Alder Land. We'll certainly take that into consideration. Alder Perez.
Thank you, Your Honor. I just, in that same vein, I've gotten some feedback about, I think it was the paper that printed the emails that were sent in and with email addresses and so forth. And I would request that if we're going to provide public comment, a name and maybe an address, but not an email, would be more appropriate for us in this kind of setting. I think some people felt threatened because some of their responses were not necessarily the standard one, and they felt threatened because they were contacted and made comments about their comment to the city hall, which doesn't usually happen when it's live. So if we're going to do that, let's be judicious in how we publish a person's name and maybe an address, but not an email address and going forth like that.
Okay, those are all really good comments. We will definitely look into improving that moving forward. Alder Glenn.
I know regarding public comment, and that is the biggest thing that I've been hearing from people about, that in other meetings we do call people and have them speak via phone. Would that not also be an option? Like we're at a regular common council meeting, but yet they line up to talk their 3 minutes, cut them off after 3 minutes. So at least we can hear a live person versus seeing it in black and white. I think it's more effective that way, to hear a person versus just putting down on paper. Is that a possibility to have calling?
Yeah,
public
I'll
comments?
refer your question to the clerk in terms of its possibility, and
I can definitely look in with MIS and see if it's possible. There's a little bit of concern about historically when we have people who are standing in front of us, the ability to turn them off, which we would be able to do here, but not necessarily to filter through the comments and determine that a real person is on the other line and not necessarily someone who's just going to come on and say something, which then we could be flagged on Facebook. And if it's taken down on Facebook, that could affect our open record. So I can work with the attorney's office and with the IT team to see what we can come up with.
okay.
Thank you.
Alder Tate.
Thank you, Mr. Mayor. I just want to kind of reel us back in a little bit. It seems like we're getting a bit far afield from the emergency declaration and offer this to alders. I am looking to schedule a committee of the whole to discuss council proceedings, behavior, and also, virtual conduct as well. So I think a lot of the concerns that are coming up will fit very well into that conversation. As far as virtually, how do we conduct business? Generally, how do we conduct business and conduct ourselves? So, what I'm hearing is fine, but I think we should funnel this into a proper conversation about actual process as well as expectations for virtual and, non-virtual meetings.
Thank you, Alder Tate. Seeing no other persons in the queue, I will unmute everyone. When the clerk calls your name, please vote as you wish.
Alder Perez?
No.
Alder Tate?
Aye.
Alderwoman Glenn?
No.
Alder Santiago?
Aye.
Alder Peterson?
Aye.
Alder Mikva?
Aye.
Alder Levy?
Aye.
Alder Land?
Aye.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
That is 11 ayes and 2 noes.
Okay, thank you, everyone. Alder Tate, the next item for separate consideration.
Yep, 0518-20, Bill Bowers appointed to appointed to assessor and director of city development. Fiscal note, this position will be a pay scale R-11 at $62.08 an hour or $129,126.40 annually. Move to adopt.
The motion to adopt, there's a second from Alder Horton. Thank you very much. Mr. Bowers, if you wouldn't mind just taking a couple minutes to explain your experience and your interest in the role and the conversations we had that led to your appointment here today. Oh, excuse me, hang on a second. Let me unmute you, Bill. Sorry about that. Bill, go right ahead.
Thank you, Mayor, and thank you, members of the council, for the opportunity to speak to you concerning this position and experience. I guess I would say that at this point, I'm kind of late career. My career experience spans backwards in excess of 40 years, so I won't give you an exhaustive talk about my experience, but I will speak to you about the relevant portions of it and then get to the part about the conversations and the things that I've done as far as speaking to the mayor about my interest in this position. I guess I'd say that most of my career I've worked in construction, real estate, development, and management of properties and in government, around government, as well as private sector and some nonprofit sector development construction work as well. My career included working with the City of Milwaukee for about 12 years, much of it in the Milwaukee Housing Authority. As a operations manager in that position, I was responsible for pretty much all of the facilities management portion of the housing authority properties, which were over 5,300 properties at that time, which included veterans developments, low income, all types of high-rise, low-rise facilities, as well as some scattered sites. So I had a lot of experience in public relations as well as interaction with management and policy, budgeting. At that point in time, I had a staff of over 70 people. I was responsible for budgets, including fleet management, everything from that to working with the Architectural Engineering Committee for the City of Milwaukee. We were part of city development and the Housing Authority, so I also worked with the Development Department on areas where there was overlap. Other areas that I've worked in, I worked with the State of Wisconsin Department of Revenue for about 7 years. I worked in revenue as a director of assessment and manager of manufacturing assessment. Those positions afforded me a lot of information, education around tax incremental financing districts, development of business, things of that nature, a lot of interaction with the kind of things that we do here. Prior in my career, also with the City of Milwaukee, I worked in the Milwaukee Public Schools as a construction supervisor. So I was involved with the construction analysis of and renovation of public school buildings and comprehensive funding programs there as well. And in Milwaukee Housing Authority City Development, I worked with budgeting and things of that nature for our operating budgets and our comprehensive 3, 5, and 20-year plans. Much of that development is still ongoing in Milwaukee. So I've had a kind of a long background in dealing with some of the issues that city development has as well. I also worked as a general contractor, originally working for a developer, and then I also started my own business in construction, residential, commercial construction, and renovation management. Started my career in the trades in the late 70s in the Wisconsin Electric Power, so I'll bring you forward from there. Educational preparation, I have a bachelor's degree in management communication, a master's in business development, small business development, graduate certification from University of Wisconsin in state and local taxation. So my grasp of the issues that we deal with both in development and other areas of the city is backed up by experience as well as education. Some of the things that probably aren't on the resume you've seen may or may not be. I don't recall how much of this is on there, but during my career, I've been licensed as a Class 2 electrician. I've been a licensed real estate broker since 1986, a licensed real estate and general appraiser since 1996. Again, I've worked in a lot of fields. I was licensed lead risk assessor during my tenure in City of Milwaukee as well, so I understand those types of things that city development does as well. Worked with developers, and during my tenure here, the interrelation between the assessor's office and city development has been pretty strong. I've done pro forma analysis, worked on the development team, looked at many of the projects that have gone forth and some that actually have not happened, where I, as the city assessor, had to analyze the pro forma, look at the project, make a determination to the feasibility. We've looked at the development of TIDS. I've worked with Vicki on the development of the rents program, and just kind of been integrally involved in a lot of stuff. I think there's a lot of overlap between assessor's office and city development, so I think there's a natural cohesion between those. One of the other things that I specialized in education was systems theory and deep change. So as changes go about, I think some of these things are attractive to me to make sure that we do change and decision science in a way that takes us forward and doesn't hinder us. I talked with the mayor about this position simply because I think that I can add to it, and I believe that I could do both positions and bring benefit to the city. I'm interested in seeing Racine grow, expand, and I think there's an opportunity for a renaissance here. I think that in one sense, we have bare cupboards, but we have opportunity in places to do some development and the types of things that's going to expand the tax base, which is, I think, our only way to grow out of this. We're up against a time where resources are light and opportunities are even more difficult. So I think I can bring some of the things to the table that will help us based on my experiences in the past. And as I said, at this point in career, I have a lot of experiences, a lot of things. I've seen things done well, and I've seen some that didn't work, so I'm able to differentiate in quicker time than not whether some of these things will be beneficial and hopefully help guide the department away from those that aren't.
Thank you very much, Bill. First person with a hand up to speak is Alder Perez.
Thank you, Your Honor. I think you've made an excellent choice in the appointment. I have a question about the responsibilities, though. Is, R11 pay scale sufficient to cover both things, or is this something that we're going to have to come back later and say, because he is covering both, we need to give him some kind of stipend because of his dual responsibilities? How are you thinking about that as we move forward?
Yeah, I'm going to ask Kathleen Fisher to answer that question in terms of the adjustments that we're making to his salary and the flexibility that we have to do that. Just let me unmute her real quick. Kathleen, are you there?
I am. Can you hear me?
Yes.
Perfect. Thank you, Alder. So the area of the scale that we are putting Bill is at the very top of the scale under the Carlson-Detman study. It is the same area that the previous director was at. This is for the remainder of 2020. We will take a look at if it needs a potential adjustment. That would be part of the 2021 budget presentation. But that is going to take some time to analyze with the two positions together.
Your Honor, due to the thank you, due to the significant task of both being the assessor and the director of city development, is it fair to him to have to cover both things at this point? Because they're both huge responsibilities.
Yeah, I'll let Bill, he referenced it a little bit, but there's more of an overlap between these departments than you might initially think looking at them. But I'll ask Mr. Bowers to sort of clarify the workload that might be before him.
I think that there is, as the mayor said, and I actually said to him earlier in discussing this, there are things that the assessor's office staff does, and I think there's a synergy between the two, where the sum of the parts will actually get more done because of the efficiencies that we have. There are things that the assessor's office is the real property lister, and we do plats and we do all kinds of changes. Well, city development does, certified survey maps. So there's some stuff where we're already working together where I think things can happen. Now, there's certainly analysis that we do that is duplicative of what they do in city development. I think that we will be able to use the staff that's in both departments, I think, to kind of do the things that we need to do. There's a lot of efficiency there. And I think I certainly will be asking the staff to do a little bit more in terms of what they have been doing. But we were already working and talking about how to utilize the assessor staff in support of some of the other things that were in the other departments. So I think this will give a little bit of clarity. I imagine there would be some analysis, as interim city administrator said, that may take place at a later date. But I think given the times that we're dealing with right now and the conditions, I think getting going forward with it is what's really important here.
Thank you.
Thank you. Alder Peterson.
Yes, question for the mayor, and then one or two questions for Mr. Bowers. In the past, they've done national searches for these types of positions. I've never been a big fan of that. I prefer the local hire, so I'm all for Mr. Bowers getting the job. Was there any type of outreach or was there any type of job search put out there, or was this just you found somebody you found somebody suitable for the position, you felt that would just move that direction?
Yeah, I will try to maintain my role as chairing the committee, but also try to answer the question you're giving me for a sense of clarity. I mean, obviously I have a high degree of confidence in Bill Bowers, or I wouldn't have recommended him to you. I have an extraordinary degree of confidence in him, in fact, to the point where his willingness to do this, for me, made the need to do a national search redundant and unnecessary. Bill's intimately involved in all of our development agreements and has been since I started here. And I think, I don't know that he would disagree with me with the statement that I've asked Bill substantially more development-related questions since I've been the mayor than assessor-related questions. He's been instrumental in some of the neighborhood TID and some of the other creative things that we've done moving forward. So when he expressed an interest in doing this, I actually felt blessed and fortunate for the city and the opportunity that it creates to bring his historical knowledge, his breadth of experience, and the ability to keep the developments that we are engaging in without having to pause to find a new director and bring them up to speed.
Thank you very much. I was just curious about the process.
Yep. And then did you have other questions for Bill, Alder Peterson?
Yes, please. Do you anticipate come budget time to maybe officially combine the two into one position so it can actually truly be a financial savings going forward? And two, you seem very highly qualified, and I'm looking forward to you being the city developer. But I'm curious, I don't know very much about you. Are you a local resident? Where do you reside?
Bill?
Currently, I just moved out of a place in Racine and looking for another. I have a residence also outside of the city, but I typically do have residence here. I go between the two for reasons that are family reasons rather than anything else. So I'm somewhat in between there. In terms of the question about the budget, I guess that would be a better question for Kathleen as to how that's going to develop going forward. My anticipation is that the roles will work together. However, there are licensing requirements by the state for the city assessor, and I'm not sure that that can be readily changed. So there are some state statutes that govern under Department of Revenue how the city assessor position functions, as well as some city ordinances that I suppose that role would have to continue to exist. So as far as the budget impact, I guess that would be better answered by either the mayor or the interim administrator.
Yeah, I'll refer your question to Kathleen Alder Peterson. Kathleen, are you still unmuted?
I still am unmuted, I believe.
Yes, you are. Please proceed.
Yeah, so most certainly, Alder Peterson, the organization of the City Development Department will be looked at during the budget process, and we will be analyzing in depth the city assessor position as well as the director of city development position. Obviously, we want Bill's input into that and what that would look like. But that will be part of the budget discussion most certainly as we move forward over the next 5 or 6 months.
All right, so at this time, there's no anticipation of melding the two positions into one. You anticipate having two separate positions?
That is my initial interpretation, yes. Again, because of the licensing regulations and that type of thing, yes.
Okay. Licensing regulations being that he can't maintain his license as a city developer?
I'm actually not as clear on that. Bill would answer the licensing ramifications of that, but he just referenced it, so.
Bill, do you want to try and clarify?
Yeah, so the city assessor is a statutory position, so that one could not be eliminated. There would have to be that position in order to sign the assessment role. And at this point in time, the director of city development is a position, and I suppose that those could be. I don't imagine that the city assessor position would rank higher than the director of development. So I'm not sure how you would do that. I think the roles can be worked concurrently and together as far as eliminating the FTE for one or the other. Again, I think that that would be a budget discussion, but certainly I could could and intend to retain the licensing and such for the city assessor. My answer was based upon whether or not one role could be all that there is. I think there would still have to be some duality there, whether it's just a working title in order for clarity or not.
Thank you very much.
Sir, thank you, Alder Peterson. Alder Horton.
I would just like to say that to Mr. Bowers, I would be in support of this. I do remember having like a town hall, and I invited him to come. He did come, and boy, I was glad that he was there because the questions that was coming towards me, I didn't have the answer for him. So I think that he comes very he's qualified, and there are not many times that you leave those type of settings with people, you know, not being upset because the question was danced around and it wasn't answered. But he really did a great job that night. He answered all the questions. And again, I was glad that he was there, and I would be in support of this appointment.
Thank you, Alder Horton. Seeing no further discussion on this item and no hands for the raise, I'm going to unmute everyone. When the clerk calls your name, please vote. As you wish.
Alder Perez?
Yes.
Alder Tate?
Aye.
Alder Peterson?
Aye.
Alderwoman Glenn? Alder Santiago?
Aye.
Alder Mi'kmaq?
Aye.
Alder Toe? Alder Levy?
Aye.
Alder Lamb?
Aye.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
That's 13 ayes, 0 noes.
All right, that motion carries. That concludes the items on the mayor's report. We will now go back to page 1 of the agenda and begin the Finance and Personnel Committee report. For that, we will go to Alder Taft. Just one moment. Alder Taft, do you have any items for separate consideration?
I have received 2 such requests.
Okay, can you please proceed with those requests?
Okay, so the first item that was that I had a request for separate consideration is item 478-20. So I can read that one.
Please.
The item 478-20 is a communication sponsored by Alder Lemke on behalf of the Public Health Administrator requesting permission for the mayor and city clerk to enter into a contract agreement with Maxim Healthcare Services to establish temporary employment for contact tracers, disease investigators, and monitors. Recommendation of the Finance and Personnel Committee is that the permission be granted to the mayor and city clerk to enter into a contract agreement with Maxim Healthcare Services to establish temporary employment for contact tracers, disease investigators, and monitors.
Is there a second for this item, Alder Horton? Are you seconding? Great. Any discussion on this item? Alder Perez.
Thank you, Your Honor. Again, is this one of those positions where they will be employed by Maxim Health Care Services and as their employees strictly responsible to them and not to us?
I will refer your questions to Kathleen Fisher. Kathleen, can you try to answer that question, please?
It's probably, I'm not sure if Bobby is in room 303, but I can answer it a little bit as well. You are correct, Alder, that these employees would be employees of Maxim Health, not employees of the city of Racine, and would be temporary contracted employees.
Okay.
Alder Perez, did that answer your question?
Yes, sir. Thank you.
Thank you. It does not appear that Bobby Fergus is still in the room, Kathleen. Alder Glenn.
I just have a couple questions, and even one of our citizens of the city of Racine had just also sent in these same questions. Contract, where's the contract for this? We have not viewed a contract.
Administrator Fisher, can you try to address where this is, or I might ask the clerk to reference attachments as well?
I was attempting to look at the attachments. I do not know that the contract itself is attached. It would be en route to the attorney's office for the attorney's office to take a look at this contract. I know that I had worked with Bobby on it. Howard, can you tell him it's attached?
Can you just address? It's the resolution to authorize it that appears to be attached, not the contract itself.
So the contract itself would be with the attorney's office.
Okay.
Alder Peterson.
A few of my questions were already answered by Administrator Bowersox that I had on this, but in reference to what Alder Glenn stated as far as the contract, my understanding is they're going to try and hire locally. Are in that contract, being that we haven't seen it, are there numbers, or is that just like we hope to hire local people, but if we can't, we can't?
I'll refer your question to Kathleen. I will just say, in having spoken to Administrator Bowersox, I think what increases the likelihood of local hires is the health department's insistence that these contracted employees will be working in our health department and located here or in the annex. And so I think that that requirement is what gives them a greater degree of confidence on hiring more local people. Administrator Fisher, do you have anything else to add or clarify in that regard?
I really don't have a lot. I have not necessarily looked at the agreement. I was just trying to look through my email to see if I have it, but I do not have the specifics of the agreement. I apologize.
Okay. Alder Perez.
Thank you, Your Honor. Since we don't have any specificity about this contract moving forward, and even Ms. Bowersox wasn't aware of the specifics of it, is it detrimental to us to table this till the next meeting, or do we have to vote on this tonight?
So I would just make the comment that the need to do contact tracing is really exigent to the health emergency that we are under right now. And while I appreciate the questions that are there, Alder Perez, what I would encourage you to weigh that against is the need to do the contact tracing so that we can begin to monitor and get ahead of the very real epidemiological challenges that we have around mitigating the virus.
Your Honor, I understand that that's a significant issue. But again, it comes to us as something where we don't have the complete information due to its need to be worked on immediately. We're not getting, the only thing we're getting is a number, $460,000, I think it was. I don't have it in front of me right now, but we really should know what we're paying for in a situation like this. And I would be highly suspect, for lack of a better word, of us moving forward to something again where we don't have all the information. I think it behooves whoever puts the recommendations together, or even the staff, to give us the information so that we can make informed decisions. I get it. You know, we need contact tracers. We want to diminish this, but this is an epidemiology concern of 2% of our people. Okay, so and I get it that it's voracious, but again, this is where I have a problem. We want to be participants, we want to be transparent, but we're not even given the whole information. And Ms. Bowersox wasn't even able to express what the information was. This kind of stuff really, it hurts us as leaders in our community, elected officials, and voting forward on this. I'm willing to wait 2 weeks to get this going because of something where we don't have any information to really look at. And I understand it may be minor and necessary, but again, look at the position you're putting us in. You're putting us in a position where you're asking us to vote on something again where we don't have all the information, and that's unacceptable. We need to have the information. I understand the micromanagement part, but you're asking us to vote on something of which we only know what the cost at the end is.
Sure.
That's all I have to say.
And certainly remind council members that this obviously is an item that came through Finance and Personnel and was vetted through the committee. It does appear that Dottie K. Bowersox may be back in room 303 if she could wave, if that is indeed her. Great. So Dottie K., could you try to answer the specifics of the desire for the opportunity for local folks to be hired or have the opportunity to be hired to do this contact tracing?
Sure. Yes. Thank you, Mayor. I'm also going to ask City Attorney Letney to talk about the contract itself. Scott, you want me to go first, or you want to go first?
Sure, go ahead.
Okay. So, excuse me, I'm sorry. Just stepped out for a moment, ran upstairs. So, the contact tracing is part of how we identify those individuals that have been in contact with someone who's COVID positive. We have a 45 to 60-minute interview minimally with each individual, and then it branch out from there to talk with the individuals that they've had interactions with. This contract, or these funds, have been released through the Department of Health Services to assist us in that process, which is imperative to be able to find out the prevalence of disease, to get individuals tested, and to provide them with education and awareness about what COVID-19 is and isn't. At the same time with this, because of the shortage of nursing personnel and the shortage of individuals who are trained in contact tracing, we have this group, this contract group, company that are getting those individuals. We don't want to hire them as employees because the money expires at the end of this year. So there's no carryover at this point, and we can only utilize them for contact tracing. They cannot be utilized in any other format. Scott?
And then Alder Letney, did you have any details that you wanted to add regarding the contract itself?
Sure, I have the contract right here. Yeah, I have the contract, and I've been working with Maxim Health Care's contract representative to get it done. There is not a specific requirement for city residents or local residents to be hired. There is a requirement that any employees, any persons hired by Maxim Healthcare to perform this work are required to have qualifications that are defined by our public health department. So Bobby and Dottie K will be able to help control the type of employee, type of person that's brought in, the qualifications of the person that's brought in. But again, there's not a specific requirement that it be a local resident, and there may not be lots of qualified local residents to do this work, so
right. Yeah,
that could be an issue.
Yeah, and again, we're looking for registered nurses. We have 2 individuals at this point that we are contracting with that are City of Racine residents, but again, there is a nursing shortage, and this is a very specific niche for an individual to engage in the contact tracing.
Thank you, Attorney Letney and Administrator Bowersox. Alder Tate.
Thank you, Mr. Mayor. So that was one of the questions I had during committee was, ensuring that the standard with which we were applying for who would be hired wasn't going to be exclusionary to kind of the educational system that exists in Racine, particularly Gateway. So I heard we're looking for registered nurses. Are we also considering certified nursing assistants for this work? Because I think there's quite frankly, a larger population of people with those particular qualifications in the City of Racine, perhaps not working at this time to be able to do this work, as opposed to our registered nurses who might not live in the city of Racine. So I think, the questions that the other alders are asking as far as, what's in the contract, is there specifications for residency requirements? Because this is a temp agency we're working with, we could kind of put that in there if we wanted to. But also, are we setting our minimum standards beyond the degree that's actually necessary to do the work, and also excluding a pool that exists of employees that probably more likely exists in the city of Racine?
Administrator Bowersox?
Yes, thank you, Alder. Yes, we are looking for registered nurses. So because of the extensive information that we have to gather, the information about their health, the information about what their symptoms are, their interactions with their primary physician, interactions with testing, all of that together, we feel that that's the best recourse, is to have an individual that has that extensive nursing background.
Alder Tate?
I understand the response. It's not necessarily satisfactory because, again, the folks who are, if we're concerned about residency, which we are, and we know who are our residents and what education is available in the city of Racine, and more often is taken advantage of in the city of Racine, particularly Gateway, they produce a lot of certified nursing assistants. And I'm wondering why that's not a target audience for this particular position, as it is contact tracing, and they've gone through a degree of nursing training that I don't see. I need a good argument as to why they wouldn't be, a target for employment in this role.
Administrator Bowersox?
Yeah, and again, Alder, it's the extensiveness of the education in response to what they will have to interact with each one of the individuals that are positive and those individuals that they're contact tracing. So again, we want that level of education. Gateway does graduate registered nurses. So individuals from Gateway that have that degree are applicable to be contact tracers.
I'm done.
Okay. Alder Peterson?
Yes, back to the contact tracers. My understanding is up to this point, you've used other people throughout the city to assist you. Is that correct?
Yes, we've had assistance from the library, the fire department, and the police department.
Any of them registered nurses?
No, but at the same point, the fire department, they are EMS, those individuals, as well as the prevention individuals, they're used to, as well as law enforcement, doing interviews and investigation within that cachet.
I was an EMS, I was a firefighter, and I can tell you there's nothing the CNA could not do that me as an EMS firefighter, EMT could not do.
Yeah, and the bulk of their responsibilities was data entry.
So they didn't do any contact tracing, just data entry, no phone calls?
Fire department did do contact tracing because they did have that medical background. Library has done some contact tracing along with being supervised by one of our public health nurses though. They work with them and they sign off on all of their cases that they're following up on. The registered nurses, whether they have a 2-year degree or a 4-year degree, because they are a registered nurse and they're board and they have their board, there's less supervision that needs to be overseen per case.
I'm all for the contact tracing, but it just blows my mind that we need a registered nurse to make phone calls, and it's basic HIPAA questions. I mean, it's mind-numbing.
Well, yeah, and these are more than basic HIPAA questions, Alder, just for clarification. Again, this is anywhere from 45 to 60 minutes talking to them about their current medical history, their past medical history, medications that they're on, how often they take those medications, interactions with their primary and or any specialty physicians, what their symptoms are, how long they've had their symptoms, how that interrelates with their medications. So it's not just a matter of who you sat to next at dinner, but it's a complete medical history about where they're at and then what they can expect or what they're experiencing.
Alder Jones.
Thank you. I just have one question. Do we still have LPNs in the medical field?
Administrator Bowersox?
Yes, there are.
So would they not be as well as, maybe not as well qualified, but just able to do that work as the RNs?
Administrator Bowersox?
Oh, thank you.
They would be able to do it with oversight from
Yeah.
a registered nurse.
Yeah, and again, it's the oversight with a registered nurse. We have just, what do we got, 3.5 or 4.5?
We just have 4.5.
Yes, we've got 4.5 registered nurses. And as these positives come in and as the workload expands, we still have our normal communicable diseases in which we investigate. We still have TB, we still have all the sexually transmitted diseases, we have every other communicable that, again, that we investigate on an annual basis. And so the less time that we have to spend on each one of these contracted individuals and that they can work independently, the better collectively for what we do and how we do it.
I guess, Administrator Bowersox, can you clarify, just so I understand, because I'm hearing a series of questions from the alders where it seems like what you're saying is CNAs or LPNs could do this work, but there may be a requirement that then requires oversight from an RN, and what you're attempting to do with this contract is free up the staff time of your RNs to deal with the big caseload that you're dealing with right now in the middle of the pandemic. Can you explain that oversight requirement that would exist for people who have different certifications or licensure?
Sure. Yes, thank you, Marion. You put it very succinctly, and thank you for that. So, because that is one of the issues. I mean, we have our regular workload plus the COVID. And as we've seen in the past, as the numbers increase, obviously the amount of work that we have increases as well. Do you want to?
I mean, from a public health standpoint, we have state statutes that require certain
and that's,
degrees.
yeah, and as Bobby has reminded me, we have specific state statutes for nurses within public health and what their expertise and what their certification needs to be, and that is bachelor prepared RNs, and that's why the 4.5 nurses that we currently have are all bachelor's prepared. They are able to have those type of interactions with clients at a higher level that doesn't need that oversight, and we don't have to have another individual sign off on all their documentation and all their education and all the information that they gather, as well as the information that they provide to each one of these clients.
Thank you. Alder Lemke.
Hi, so I obviously a supporter of public health and want to see this move along. And I sort of understand the concern with, CNA's kind of issue, but with respect to LPNs, I just pulled up the Gateway, what looks like to be the LPN 2-year degree, and it has, they're like coursework, and it has anatomy, physiology, pharmacology, clinical practice, lifespan considerations, complex health, and I understand that a CNA is maybe, more not, I don't know, but the LPN looks, like they have quite a bit of, pharmacology and that kind of thing for the 2-year degree. And I mean, I want to see us move forward with the contact tracers, but I think it would be good to also consider, LPNs or what have you, as Alder Jones mentioned. And I mean, in the library too, I see the oversight question, but like in the library, they didn't have nursing credentialing and whatnot.
Administrator Bowersox?
Yes, in order to clarify, the bulk of the library, what they did for us was data entry. So the nurses did the contact tracings, they put the information together on a piece of paper, they took the paper and they put it in the state application. So they were doing the data entry for us and answering the telephones, taking messages, distributing those to staff.
Thank you.
Thank you. Alder Tate, did you have your hand up again?
Sure. So I think it was no, but I'll keep going anyway. I think two things need to happen in order to for me to be able to support this as it is, or at least as it's presented, as opposed to referring it back to committee. One, we need to include in our actual contract a preference, if not a percentage, of City of Racine residents. And then two, I don't want to use the term standard, but I think what we're looking for in terms of employees needs to be broader so that we're not indirectly or unintentionally excluding a good portion of our residents who may have a certain qualification that we're not looking for. And I think that just has to happen. I think that satisfies ultimately a lot of the Alder's concerns, but it also addresses, some systemic inequity issues when we talk about hiring within government. When we set our standard at here, you can't see it, but my hand's high. But when we set things to a certain standard, we inadvertently exclude populations that could either fulfill that work or are ultimately the population that already exists in our pool, and we're excluding our very own residents in those moments. So I think, in order for this to go forward, those two things have to be addressed and very clearly and kind of unequivocally addressed and introduced into the process.
Thank you. Alder Glenn.
Thank you. I thought you forgot about me, but I do have a few questions. These employees or these people that we will be hiring or contracting through Maxim, where will they be working? I know the health department is so crowded down there in the basement. Will these be work at home or will they be here on city property?
Administrator Bowersox?
Yes, thank you. They will be here on city property. They will be in the city hall and potentially in the annex. We've got space already identified, computers set up and such.
Okay, great. Thank you. I still have a couple more questions. Was Maxim the only company you looked into, or did you look for other?
Administrator Bowersox?
Yes, thank you. Yes, there are other contract tracing companies. We're asking for Maximum because multiple health departments in the state of Wisconsin have utilized them and have had good reviews about the individuals that they've been able to supply.
Okay. What do you think the length of these employment would be for this?
The grant itself, thank you, Mayor. The grant itself is only through December of this year, and the monies cannot be carried over. They expire in December.
So, yeah, actually, about how many people are you looking for and the hours you're looking for them to work?
We're looking for 5 individuals. 2 have been hired. Both are City of Racine residents. At the same point, they would be here 40 hours a week, Monday through Friday.
And what is the premium that is paid to Maxim for their employment versus what they're actually receiving?
Do you have that one?
I don't know. Ma'am, I have the rates that that Maxim would be paid. I don't know what they're paying the people that are being hired.
I think that's very important to know. If we are really looking for registered nurses, it's very important to know what they would be paying, that they are getting paid market rate for their services. Granted, they're basically only talking on the phone and data entry. I would really That's something that really interests me. That's why I think that maybe we should send this back until we have these questions answered.
Yeah, and Alder, with all due respect, it's not as simple as asking questions and doing data entry. This is a complex process to gather this information about each one of these individuals and the people that they've been interacting with, and then gather their information and then put it all together. So it is a complex process. Again, I only have 4.5 registered nurses that are responsible for doing all the communicables. That's why it's important for us to have registered nurses so they can work on their own. At the same point with that, the way we've contracted in the past with temporary agencies, not only for the health department, but as I understand it for the city, we have the contractor, and any of the pay for the individual who's providing the services is determined between the contractor and that individual. They have a separate contract that they engage in for whatever the hourly rate that the two of them agree upon.
Okay, but we don't have the hourly rate that Maxim is going to be charging the city.
No.
That we have.
Yeah, that we have, but I do not have the rate that they're paying their employee that is contracted with Maxim.
And what is that rate?
It's between $30 an hour and $75 an hour, depending upon the title of the person that's hired by Maxim.
But I mean, for these temp service, there is a premium percentage for a markup. And it's standard. So, I mean, $30 to $75, that's a big range.
Correct, but again, that's the agreement or the contract that they would have with that nurse or that individual that they're contracting with.
Okay. Thank you, though. Thank you.
Oh, thank you, Alder. I
Peterson.
appreciate the question.
Yes.
Alder Peterson?
Yeah, sorry to beat the dead horse. I'm looking at the state website. The state has been hiring contract tracers, and there's no real requirements for them. They see the contract tracers, not the ones that are talking to the people infected, but the ones that are talking to those who are near the people who are infected. They said, here are the questions you will ask: your name, your address, your phone number, your email, your gender, race, ethnicity, and whether you have any symptoms. The contract tracer will go through quarantine recommendations and sign you up for self-monitoring. There's nothing in there as far as doing the extended contract tracing, not talking about the person infected, but the actual tracing that requires any medical training.
Administrator Bowersox.
Yes, and thank you, Alder. That process is, what happens is that those individuals at the state level gather minimum amount of information, and then they provide it down to the local level that has to do extensive information gathering and interaction. So they are just a first step. If you engage with them, and then they just get that minimum amount of information again, and then provide it to the local to continue with.
But isn't that what you're doing, hiring contact tracers? I mean, isn't this the job that they're going to be doing?
Yes, but that doesn't mean that every contract tracer at every level is the same. Again, the state, if you engage with them, only does a minimal amount of information. They provide that to the local to do an expansive interaction with those individuals.
So if you talk to somebody that's been next to somebody that's been infected, you're going to ask their medical history, you're going to ask all these crazy questions just because they've been next to somebody?
It depends on how long they've been next to them. So if they were sleeping with them, if they lived in the same house with them, or if they were simply, 2 doors down and met them on the sidewalk, each case is very different. Each interaction is very different as far as the number and the amount of information that you will gather.
So Administrator Bowersox, could you, I think you mentioned this earlier, but could you explain to the council the average length of time that these interviews take?
Yes, it can take anywhere between 45 and 60 minutes. depending on, you know, depending on if they're the positive or if they're a close contact to the positive. And it can be more depending on their medical history and the symptoms that they're having, but no less than 45 to 60 minutes per individual. And this is for the initial contact. So we follow up with these individuals to find out how they're doing on a regular basis and to gather additional information from them.
Alder Perez.
Honor, I totally agree with Alder Tate. I think he hit it right on the head. But I have a question for clarification for the city attorney. Did he say that this contract was still in his office, meaning that the details of the contract were not yet finalized? Can he answer that for me, please?
Attorney Lutney?
I sent the final version to the contract administrator for Maxim with some just some technical changes, and I'm not sure that I've gotten that back yet. But they sent us the contract. I made some technical changes and asked for those to be done.
Okay, so you're asking us to vote tonight on something that has not been finalized officially. None of us in our right mind would ever sign a contract without knowing all the details. If we do, we're making a mistake. We're not fitting in the requirements that Alder Tate talked about and that we've committed to as a city to try to employ our own members to lift up our community with good paying jobs, even if they're temporary. And the other questions that have been asked are about Maxim Health's requirements or the state requirements for contact tracers. So I really don't think that we're prepared to vote on this tonight. And I would vote no if we're going to go forward with this, because there's just not complete information. It's not, it doesn't hold true to what we have agreed to as a city. And it perplexes me that because we think there's an urgency, we are expected to vote on something of which we don't have all the information. And it doesn't even meet our own criteria for hiring of people or organizations. And so that's what I have to say. I don't know if someone else would like to move this to be deferred for a couple of weeks until all these challenges can be met. But at this point, I'm voting no.
Alder Tate?
Thank you. Now, the one thing I will say is, as far as the specifics of the contract, now what the council is approving isn't the contract itself, but it's authorizing the mayor to enter into a contract agreement. So I think, you know, if we're making specific demands about actions, then what we ought to be saying is, you know, can the mayor commit to not signing a contract that does not fulfill these particular demands of the council? Not necessarily, you know, having to see the contract, but saying we authorize you to enter into a contract with these particular stipulations. So I do want to kind of clarify that for the council in terms of what we're actually approving is not the contract itself, but authorizing the mayor to approve a contract and go into an agreement. But I do think it's very important that, you know, we at least get to see it. And I think, you know, the piece that the questions that we asked and Attorney Letney was able to answer do point to kind of what our policy concerns for this council. Our policy concerns are we want as much as possible, as often as possible, when we're issuing dollars, for those dollars to be returning to city residents and employment. And we also need to recognize that there are systemic inequities, whether in education or demographics or whatever, that, you know, our employment base might not have all the RN degrees, but they may have the LPN, as Alder Jones had said, because of our local education, where people can achieve, you know, where they're near, they will take advantage of. And Gateway is near, and that is one of the degrees that they offer, particularly for folks who, you know, may be working. You know, they take the 2-year degree as opposed to the 4-year degree, and that's just, you know, who we have available to us, or who we may more likely have available to us than not. So I want to make sure that policy-wise, the council is kind of taking steps to say, when we go into contracts, we'd like these things to be addressed. You know, a number of residents, percentage of residents, if not 100%, then what's the lowest threshold that we want to have available? And if we're putting out standards in terms of what the lowest degree is they can have, is that in and of itself exclusionary to our population? If so, then we need to be looking at that and reviewing that and viewing it through that lens. So going back to my point again, though, I think for alders, if there's a particular motion that needs to be made in regarding the contract that's gone into, I think that the appropriate motion would be to say, approving with X, Y, and Z being met. If not, then deferral would be appropriate. But I'd want to perhaps hear from the mayor in terms of his appetite for fulfilling the council's kind of demands as it relates to this contract prior to us taking any action about kicking it back.
Yeah, I mean, so I can make some broad comments on a policy basis. I mean, I think people know, and one of the first things I did as mayor was implement the Racine Works ordinance, which seeks to have a local hire component up to a certain percentage of incented work that we do. I do know that there are restrictions that the state legislature has put on local units of government on how much of that can be done. And so I certainly share the enthusiasm that everybody has expressed here to hire local and to keep these dollars in the hands of city residents. It's I guess the only thing I would pose to the city attorney is what restrictions or limitations might exist to say, for example, putting a 20% or 40% hiring requirement on these positions to be local, if at all possible, or something along those lines, if that would create problems within the contract or run up against any statutory problems.
There is a requirement under the statutes or a prohibition under the statutes of favoring local contractors for public works contracts. In other words, that may not be done. There may not be a requirement to only hire a local contractor for public works contracts. Of course, there is the prohibition in state law against a residency requirement for municipal employees, but there wouldn't necessarily be such a prohibition for a contract like this. It would simply be a matter of practical application of the number of people that meet the qualifications that live locally. As the mayor said, just as a way of example, the Racine Works ordinance requires contractors that are paid, that it's more than $250,000 that are paid from city funds, have to be 20% of the hours worked have to be worked by City of Racine employees. So that's one standard that at least exists by ordinance.
So I wonder, Alder Tate, if that might be, if there's an appetite to amend this thing to perhaps apply the Racine Works threshold to this contract might be a way to address the concerns that we're hearing here today.
Well, I think Administrator Bowersox had said that we already have 2 hired out of the 5, or are we hiring 5 additional in addition to the 2?
That's a good question. Administrator Bowersox?
Yes, thank you. We would like to hire a total of 5 individuals, and we know 2 individuals are possibilities, are applicable, and they are both residents of the City of Racine.
So in that regard, we would already have satisfied Racine Works, and I'd rather go beyond that for the remaining, like 80%, 4 out of the 5, since it's only 5 positions. And I don't have a doubt that there is an LPN or RN who lives in the City of Racine who needs work right now. So, I mean, if we're going to spend these dollars, which I think we should, because contact tracing is critical to dealing with the epidemiology of this virus, I think if we're going to spend it, we ought to keep it within our boundaries, within our residents, within our tax base, if you would, as opposed to sending it outside. Like so many of our funds currently happen with City of Racine residents who don't live within the boundaries, or employees who don't live within the city. So yes, Racine Works can apply, but it's already fulfilled, it sounds like, too. So that's part of my concern.
Would you like to make an offer of an amendment, Alder Tate?
Yes, I mean, well, I mean, I would yes, I move to amend that the contract include an 80% requirement of Racine residents.
Okay, is there a second on that, that item? I think Alder Levy is trying to say second. I'm trying to unmute her here.
Yes.
Yes. Okay, great. So there's a motion on, or an amendment to the motion on the table to require an 80% local hire requirement of the positions for this contract. Discussion, Alder Tate, do you want to speak to the motion? Does anybody else want to speak to the motion or to the amendments that we have before us?
I've said enough about it, so I certainly offer.
I see other hands that are up. I don't know if those are for the main motions or the amendments, so I'm going to unmute those to ask if they'd like to speak to the amendment, starting with Alder Peterson.
Yes, just a clarification. This is going above and beyond the Racine Works. Instead of 20, we're looking for 80%.
That is what the motion is. It would be an 80% local hire requirement of those being hired under this contract.
Thank you very much.
And may I respond, Mr. Mayor?
Please.
And part of the reason the 80 is because we're only hiring 5 people. That means 4 people would be Racine residents out of the 5. I think in other situations, 80% might not be a tenable number to work with, but I don't have a doubt 5, LPNs or City of Racine who are looking for employment at this time.
Alder Perez.
Yeah, Your Honor, I'm a little confused now because I agree with Alder Tate, but the Dottie K said that she has hired 2 people. We're talking about Maxim Health. Is she doing the hiring for Maxim Health?
Administrator Bowersox?
Yeah, no, for clarification, Alder, we have 2 applicants that are applicable. So we haven't hired anybody yet because the contract has not been completed.
Yeah, but why would you hire anybody if it's Maxim Health that's doing the hiring?
No, I'm not hiring anyone. It's Maximum who's doing it. They just sent us some applications or some individuals that are applicable for the positions. And the 2 and we have 2 of them that are City of Racine that are applicable, but we're not hiring them. The health department's not hiring them, or the city.
Alder Perez, does that clarify your question?
Yeah, but so because maybe this is a city attorney question, but because we're contracting with Maxim Health, can we require them to meet our standards? Is that normally how that works then? So because
well, we can ask them if they are willing to include that in the contract. They could decline and decide they don't want to enter into a contract under those standards, but I certainly am willing to go to them and ask them that.
Alder Perez?
Yeah, it just seems that we keep talking about whoever we hire, city employees, and I'm all for that, and I agree with most of what Alder Tate has said. But looking at the way this is phrased, this is a contract agreement with Maxim Health, and then Dottie has said that they already have looked at 2 of the applications that were good, that she's hired 2, maybe she misspoke or we misunderstood. So I guess she has some decision-making process in this as well. So I'm still going back to, I like the amendment, but something that Alder Tate said confused me even more. He said that we're not voting on this, we're voting on authorizing the mayor to vote on this. Okay, yeah, that's what you said. And I wouldn't give my sister the opportunity to vote on something that I tell her, go ahead and do this without me fully vetting it. So I think as we go forward, we have to say, yeah, we authorize the mayor on our behalf to do this, but then we have to be the people that agree to it. It can't just be, okay, yeah, we're authorizing him to do that. It's not our call. It is definitely our call, whether we give him permission to go into a contract or not. And we're giving him tonight, based on the amendment now, you know, saying, yeah, I guess you can go into a contract if we need all these other requirements. Is that what is being stated? Can you clarify that for me, please?
Attorney Latney?
Well, Alderman, you are correct in that the Common Council authorizes contracts and by its action authorizes and directs the city clerk and the mayor to enter into the contracts based upon the standards that the Common Council requires.
Okay. So can you detail for me then what the amendment is and how it fits into this? Can you repeat it, please?
Attorney Latney.
Thank you. My understanding of the amendment is that, and I'll ask for clarification because I think Alder Tate said that 80% of the positions would have to be filled by City of Racine employees. I would note that the Racine work standard is 20% of the hours worked. Although we're talking about hiring, the maximum, we talk about hiring 5 nurses, there may not be, or 5 contract tracers. It may not be that there's 5 at all one time. Maybe there'll be some that work a couple of months and quit and leave for another job and somebody else gets hired. So, and it's at least possible that there'll be some that'll work fewer hours and some that'll work more hours. So, but my understanding was 80% would be City of Racine residents.
Alder Tate, does that accurately reflect the amendment that you made?
Yes.
Thank you. Alder Taft.
Thank you. So I guess I just have a couple clarifications because I support a lot of what my colleagues are saying about wanting to hire Racine residents, but my concerns are two. One, Administrator Bowersox, would you be able to clarify? So these are not city employees, but there are there or are there not? Maybe this is a question for Attorney Letney. Statutory requirements for the education of people that are working in the public health department in these particular positions. Like, is there statutory requirement? Can we hire LPNs, or can LPNs work in this position? Or not, or does it have to be RNs statutorily?
There is a specific statute on the qualifications of public health nurses. It's section 250.061. The qualifications of all public health nurses shall be prescribed by rules promulgated by the Department of Health Services. All public health nurses shall be registered nurses. There is a provision, though, that says that licensed practical nurses licensed under Chapter 441 may be employed by local health departments while working under the supervision of a public health nurse to perform services for which licensed. So.
Okay, thank you for that clarification. I have another question for the administrator, public health administrator, Bowersox. So what is your timeline for hiring this? And the reason that this is germane to the amendment is because I'm asking about if we can't find the folks we need to do this in a reasonable time frame, I don't know what the consequences are. And so I'm all for it, but I've never tried to hire for this kind of position before. I don't know what this is like. And so I'm just trying to figure out how soon do we want to have these positions in place, and what are the consequences of a delay of, say, like if it were the minimum of 2 weeks, if it were to be sent back to committee, for example, or et cetera, et cetera. So I would be interested in those.
Administrator Bowersox?
No, thank you, Alder. I appreciate it. Hoping to have these people here Monday morning at 8 o'clock. So we need those individuals. Again, through this pandemic, I've only had 3.5 nurses. I have a new nurse that took us like 2 years to find. She just started like this last week. So it's imperative that I have these individuals as soon as possible, because not only COVID, but as I've already mentioned, I have these other communicables coming in and other high lead cases that have to be addressed. So the least amount of time that I have to have oversight, direct oversight, signing documentation, making sure that the documentation is clear, making sure they're giving out the right information, the better for my current staff and for availability for other services.
Okay, thank you for that clarification. I think that's important.
Thank you for the question.
Administrator Bowersox, are you confident that with an 80% standard that we might put in place here that's being considered here, that Maxim can meet that requirement quickly?
Oh, thank you, Mayor. I can't answer that question because we have not had this conversation with them. So I'm sorry, but I cannot answer that question.
And Administrator Letney, you said if we got this direction, we would take this standard that we would require as part of the contract. What happens if Maxim simply says, no, we won't agree to that or sign the contract if that is part of it? What happens then?
Well, we wouldn't have a contract because they couldn't be forced to enter into an agreement that they're not willing to comply with.
Any other discussion on the amendment before us? Okay, seeing none, just to restate, the amendment we have before us is an amendment to add the requirement that 80% of the positions hired under this contract would be City of Racine residents. Alder Glenn has her hand up.
I do agree with all of that, but what it comes right down to is, what does really the contract say? We don't know what the contract says. And to be even voting on something like that, we could make a suggestion to it. But I mean, I think with something like this, and as quick as we want to push this through, this is never a good thing to be pushing something as quick like this with as many questions as we have asked already tonight. So, my thing is, because, and also I already hear, and if the health administrator could answer this question, clarify this question to, it has been said, two employees are already working, is she could clarify that.
Administrator Bowersox?
Yeah, no employees are currently working at the health department or with the city from this contractor. So all we've done is taken a look at potential applicants. That's it. So the contract is not in place. It has not been signed. Therefore, no one from those agencies have been hired to work here.
And no other agencies? You have no other temporary employees working in the health department?
Yes, I have 3 other temporary clerks working for the health department that have been here for a period of time, but not through this agency, and they are clerks.
Okay, thank you for that.
Yeah, thank you.
Thank you, Alder Glenn. Alder Taft, did you have your hand up again, or is it up from before?
Nope, sorry, from before. I will lower it. My apologies.
Okay, great. So we have no other debate on the amendment before us. Again, the amendment is to require that the contract include a provision that 80% of the people hired be City of Racine residents. I'm going to unmute everybody when the clerk calls your name. Please vote as you wish.
Alder Perez?
Yes.
Alder Peterson?
Yes.
Alder Tate?
Aye.
Alderwoman Glenn?
Aye.
Alder Santiago?
Aye.
Alder Mikma?
Aye.
Alder Levy?
Aye.
Alder Land?
Aye.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones? Alder Taft?
Aye.
Alder Young?
Aye.
13 ayes, 0 no.
Okay, now we are back to the main motion as amended. Is there any further discussion on the main motion as amended? Alder Peterson.
Yes, being that there's a possibility that, Maxim Healthcare might find this, unacceptable, would it be appropriate to defer this for, I wouldn't mind having an emergency meeting. You can call it yourself for anything. I would like to see it deferred until the contract itself is agreed to by Maxim. And if you need to have an emergency meeting in 3-4 days after we actually have a written document that, and if they find it unacceptable, if they come back with a counter, maybe we can answer the counter. But I would like the chair's opinion on whether or not it would be okay to defer this. We can say it for 2 weeks, but I have no problem with the emergency meeting in 2 days, 3 days, whatever.
So I would just.
I understand the need to get this done. So I'm not trying, I don't want to defer it for 2 weeks, but.
Right. I mean, I'll let Dottie K. Bowersox address the timeliness of the contact tracing that we're trying to achieve here.
Oh, thank you, Mayor. Yeah, it's very important that we get this done. So it just is. We're in the midst of a pandemic. We have positive cases that come in on a regular basis. I've got staff that have been extended for months now, literally. So it's imperative that we take this additional resource, that we expend these funds to assist with the bigger picture as well as with a smaller picture, which would be the resources necessary for the health department.
Okay. Any further discussion on the main motion as amended? Alder Tate.
Thank you, Mr. Mayor. I guess to Alder Peterson's question, once this has been finalized, or at what point would the contract be executed? Like, what's the timeline on the execution of the contract? So I think that's to Alder Peterson's point of, like, if we're still going to present this to them, how much time between execution and, hiring is required for this to transpire. I guess that bit of time is just important.
I'll ask Attorney Letney to answer that question.
Well, if the council approves it, I'd get a hold of their contract administrator who's local and try to get it signed in the next couple of days.
Okay. So is there anything that prohibits you from presenting and kind of having that first conversation about here's what the city wants, is this amendable, and doing kind of reverse as opposed to approval and then going forward?
Alder Tate, could you repeat that? I'm not quite clear on what you're asking there.
Sure. So is there anything that prohibits that process kind of happening in reverse with presenting what the city has effectively approved, or at least directed the mayor to enter into, and then kind of coming back in to Alder Peterson's point, to then approving, I guess, the actual going into the contract?
So,
if that makes sense.
Are you asking if I contact the contract administrator and they say we're willing to meet the 80% standard, then we can go ahead and have the mayor execute it. If they say we're not willing, then presumably the council would have to address it again.
Right.
So I can have that conversation tomorrow.
Okay. I think that's just what I wanted to clarify. Thank you.
Thank you. Alder Glenn?
I am for deferring this back. I mean, it seems it's a local person that the city attorney is working with right now. I really think this contract is very important. I understand the importance of all of it, but I also think that, like I said before, we have so many questions. We need to pinpoint exactly what the contract says, does, how much they're going to be paid, the markup, everything like that. want to get the most out of this $460,000. And I think we need that contract before we can go ahead and vote yes. Thank you.
Thank you. Alder Perez?
Thank you, Your Honor. So I have a question. If we vote no on this today and kill it, does that prevent the city attorney from yet going to Maxim Health Care Services and saying, this is what we'd like to do, and then you, Mayor, calling an emergency meeting, say, okay, they've approved this contract. We now have it before you. You've had an opportunity to look at it, and we need to take a vote today, with us understanding that it's critical in that way, and with a 24-hour notice, and then we vote on it instead of holding us hostage now, saying, hey, we got to go back, we got to do this. Let's just vote no, and then still authorize the city attorney to move forward with a contract until he can come back with an actual contract that says we've agreed to this, and then we can go back and say, okay, now we can approve it or not. What prevents us from doing that?
That scenario is certainly possible if the council disapproves this contract, but provides me just generally some guidance as to what you're looking for. I can talk to the contractor, and if the mayor chooses, he can certainly call a special meeting.
Okay, thank you.
All right, any further discussion on the motion before us? Seeing none, I will unmute you. When the clerk calls your name, please vote as you wish.
Alder Perez?
Alder Tate had something like to add, but can we
Oh, sorry. John, did you have something else before we call the roll?
Yes, so just want to comment. That's not.
John, you're breaking up a little bit. We can't hear you.
Wants you to restate the motion.
Oh, okay. Thank you, Alder Lemke. I'm going to mute everybody so it's a little bit clearer, and then I'm going to have the clerk read the motion as amended.
So the motion on the floor is to approve as amended, item 0478-20, amend the contract to include 80% of hires must meet routine works requirements.
No, that is not it. 80%.
80%.
Right, but routine work is a 20% requirement.
I thought the motion was, the original amendment was for 80.
It is, but routine works is 20.
Routine works is 20. Okay, thank you.
So if you could restate that.
Give me 1 second.
Yep.
Okay, so it's for item 0478-20. It's to approve as amended, to amend the contract to include the Racine hires must meet the Racine works requirements, which is 20% of the hires for the whole contract.
No. Just to clarify, so take Racine works out altogether.
Okay.
As amended, it is required that 80% of the people hired be City of Racine residents. I'm looking for Alder Tate to give an affirmative nod. Yes. So
okay.
Thank you for the clarification, Alder Tate. Just want to make sure we're all on the same page on what we're about to vote for. So with that, I will unmute everyone. When the clerk calls your name, please vote on the motion as amended, as you wish.
Alder Perez?
Before we continue, ma'am, I think Dr. Cox had her hand up and she was not acknowledged.
Oh, you are correct, sir. Alder Taft.
Muted her.
Oh. Sorry, let me mute everyone and then go to Alder Taft.
I'm sorry. I just.
Hold on just a second. Okay, please go ahead, Alder Taft.
Okay. So you can hear me? Okay.
Yes.
So my clarification was voting on this motion, and if we vote this down, then we do not authorize the mayor and city clerk to enter into agreement. And I'm not sure that was the intention of what we want to do. I mean, I just want to clarify that it is possible that we could say we allow the mayor and city clerk to enter into such an agreement pending, and then pending final approval from council. Like that is one way we could also go. But I don't know if that's a motion I could make at this time because we're already voting on something like that. Like, I don't know if I could make an amendment that like we could authorize you to enter in this agreement, and we were like it to require final approval.
It is, but then it would delay the ability to hire those people until we came back again to consider the item.
I understand. Okay. Thank you.
Okay. Alder Tate, you have your hand up again?
And part of it was just for process-wise, so that other alders understood what was happening, because there's a lot of conversation about specific actions, but there is no particular motion on the floor to effectuate that action. So I'm hearing others say, considering a deferral for a short period of time and getting information back from other city attorneys, but there is no motion on the floor. And process-wise, you know, either this passes right now, or it doesn't. There's a possibility it passes right now, and then there goes the opportunity for it to come back. Otherwise, in that case, if you want it to come back and you want to delay this, a motion to defer for an indeterminate period of time, whatever is discussed, would be appropriate at this time. If not, amending to provide some specific direction to the city attorney would also be required right now, because once we vote, that's kind of it. So it's kind of a speak now or forever hold your peace moment. No, I make sure that alders understand that, so that they speak now as opposed to voting and not really knowing what to do afterwards.
Alder Taft.
No, I'm sorry, I'm not ready right now. I was going to make a motion that we get it, that we allow you to enter into this contract pending approval via a special meeting to happen before, by Friday, or something. But I don't know if that's something I guess I would ask the attorney for advice on the feasibility of that and how that would move forward if I wanted to make such a motion to give it a defined time frame in which it is returned to us.
Attorney Latney. Oh, let me unmute you, Attorney Latney. Sorry. Attorney Latney, could you respond?
Yeah, thanks, Mayor. You certainly may make a motion to defer, and it could be to a date certain. It could be to some indeterminate date. That is certainly the privilege of the maker of the motion to decide what you want to do, but you could do that if you want. So your question is, can we say approve it subject to later approval, or just defer the whole thing altogether?
Alder Taft?
They approve it subject to later approval, with the expectation that opportunity for approval would occur no later than Friday, but I don't know if that's feasible to get done working with another company, so I don't want to sort of hamstring folks.
Point of order, isn't approval subject to later approval just a deferral?
It is. I mean, I think we're, I guess I would just remind the council of this. I mean, this is not unusual for a resolution to be passed to authorize the mayor and the clerk to enter into a contract. This is the standard procedure we use on many items, on many agendas, repeatedly. I appreciate the really robust conversation that we've had here tonight, but Alder Lemke's point is well taken. Sort of pre-approval and then a post-approval is essentially the same as a deferral. I would just like to reiterate for everybody, we are in the middle of a pandemic. We are trying to get through this and do the community tracing and get ahead of this so that we can go back to beating the virus and getting life back to normal. So I appreciate the robustness with which we have had a conversation about inclusion on this hiring process. I cannot tell you how overworked and exhausted the public health department employees are, who are doing heroic work without vacation going on, I don't know how many dozens of weeks. They need the help to keep us all safe. So again, I appreciate the debate very much. I want to reorient the context of this motion in the public health emergency in which we currently find ourselves.
So in that case, and I agree, and I trust that the city clerk and the mayor have heard our concerns and given the and every effort's being made to hire local. So I mean, I will certainly wholeheartedly support this. I think we need these contract tracers yesterday, if not sooner. So that's I will not make any motion to defer at this time.
Alder Tate?
Oh, my hand was not supposed to be up.
Oh, sorry. Alder Jones?
I just have a question. When Attorney Letney present this to the contractor with the 80%, if they say no, what happens at that point?
Attorney Letney?
If the council's direction is that this contract may only be entered into by the mayor and the city clerk with an 80% hire requirement, then, and if the contractor says no, then there would not be a contract, and presumably at some later date, the public health administrator would bring something else back to you. If they say, we're good with 60% or 40%, or we're not going to guarantee anything, I assume that would come back to the council, but if they say no, then there would not be a contract.
Thank you.
Thank you. Alder Perez?
Thank you, Your Honor. You know, I agree with everything you've said. My only problem with what you have said is that you have discredited all of us as alders by not being, by not letting us participate in what you think needs to go forward. We're elected officials, our word needs to be heard. And I really feel disrespected by your comment, even though I agree with it. It sounded more like, I'm telling you, this is why we need to do this. I agree. But the fact that you're discrediting what's being said is really an issue for me. Now, I would like to make a motion that this get deferred to an indeterminate date until all the standards that have been brought forward can be met, and that the council has approval and ability to read the contract before it is approved.
There's a motion to defer the item to an indeterminate date until the final version of a contract can be brought back to the full council. Alder Perez, does that reflect your motion?
Yes, sir, it does.
Alder Glenn?
I'll second it.
Okay. Discussion on the item? Alder Perez, would you like to speak further to your motion to defer?
I think what we've kind of all been moving around the issue is this. We don't know what the contract is. We set different expectations for the contract. The contract has not been finalized. We know that this is an emergency. We know that Ms. Bowersox would like to have someone already on Monday, she said, okay? And I'm okay with all that. But I also think that we cannot move forward with ambivalence, and we need to know what we're moving forward with. I mean, that's only what our constituents expect of us. And as we move forward, we need to be more active in actually approving things that we know we're approving. If we approve this right now, we don't know whether they're going to say yes, no. We don't even know what the contract's actually going to say. That's irresponsible of us. And I think we need to recognize that. And I think my amendment kind of puts it back all in focus. Yes, it's real. Yes, we know it's an emergency. Let us be a part of it like we're supposed to be a part of it. Indeterminate date means bring it back as soon as you can, you know, and if you have to call an emergency meeting, call it. I mean, that's the bottom line there. We get it, but we want to be able to see the contract. We want to be able to be a participant in what we're voting in. We don't want to vote blind anymore. This happened several times, and it's unacceptable. And I think that my amendment to this recommendation brings it all together for us. And that's why I suggest that we vote for it. Thank you.
Thank you. Alder Taft?
I mean, I just have to say, I don't feel disrespected in any way. I trust the mayor and the city clerk and the public administrator to get the right people to do this job properly in a way to keep our city safe. We need these people. We need them now. And our public health department has done an amazing job, but they're exhausted. And I just think, I think we need to trust that these folks have been doing an excellent job managing this so far, and we need to give them the ability to do this. And we can ask to see the contract later, concerns and fine, but I think I would support this motion going forward as is. That's all.
Thank you. Alder Peterson.
Yes, I have similar concerns as Alder Perez, but with the 80% bar being put out there, I got a feeling this might be coming back to us anyway. So with that 80% bar, I have no problems with the contract and the language as such.
Alder Glenn.
Oh, sorry, I didn't have my hand raised, but as you call on me, thank you. I think this contract is an important contract. And I agree with Alderman Perez 100% on this, and my vote will be yes.
Okay. Seeing no other, Alder Tate.
Mayor, I understand Alder Perez's intention. I cannot support a deferral that is indeterminate. At a maximum, I would say a deferral of 48 hours, and if it's resolved, we would have a common council meeting on Saturday, because that's what's necessary. But yeah, as presented, the amendment, I can't support an indefinite deferral for something that's as time sensitive and critical, because Maxim wants to get paid, so they'll respond quickly, and we need the work done. So an indeterminate deferral I cannot accept.
Alder Perez.
Yeah, well, indeterminate because we have to give time to the city attorney to be able to present it and get an answer back. I want it as quickly as possible. So maybe indeterminate is the wrong word. Should we make it as quickly as possible? Would that work, city attorney?
Attorney Whitney.
Well, I'll contact the Maxim Healthcare representative right away. I can't say how quickly they'll respond to us, but I will try.
I think Alder Perez, everybody's conveyed the need to move this as quickly as possible, and I think that's understood. Okay, so before us is a motion to defer this item to an indeterminate amount of time. I'll ask the clerk to read the deferral motion.
To defer item 0478-20, the stipulation that it be as soon as possible for the city attorney being able to work with.
Clerk will call the roll. Please vote as you wish.
Alder Perez?
Yes.
Alder Peterson? Alder Peterson?
No.
Alder Tate? Alder Tate? Oh, hold on a second, I believe we're muting.
No.
Alderwoman Glenn?
Yes.
Alder Santiago?
Aye.
Alder Mikma?
No.
Alder Levy?
No.
Alder Land?
No.
Alder Horton?
No.
Alder Lemke?
No.
Alder Jones?
No.
Alder Taft?
No.
Alder Young?
Nay.
That is 3 yeses and 10 noes.
Okay, we are back to the main motion as amended. Could the clerk please read the main motion as it was amended?
All right, got it this time. Item number 0478-20 to approve as amended, and that the contract be amended to include 80% of hires must be city residents. The motion is to approve.
Alder Tate.
I move to defer this item for 48 hours.
Is there a second to defer this item for 48 hours? Alder Glenn.
Second.
Any further discussion on deferral for 48 hours? Seeing none, the clerk will call the roll. When the clerk calls your name, please vote as you wish.
Alder Perez,
Yes.
Alder Peterson,
No.
Alder Tate,
Aye.
Alderwoman Glenn,
Aye.
Alder Santiago,
Aye.
Alder Mikma,
No.
Alder Levy,
No.
Alder Land,
No.
Alder Horton,
No.
Alder Lemke,
No.
Alder Jones,
No.
Alder Taft,
No.
Alder Young.
Nay.
That would be 4 yeses and 9 noes.
Mayor, you're muted.
So I will ask the clerk to reread the motion as amended one more time. My apologies for being muted.
Item 0478-20, approve as amended. The amendment was that the contract to include 80% of hires must be city residents.
Alder Tate. Oh, try one more time. Alder Tate.
I had
Nope.
nothing.
Okay. All right. Alder Glenn.
Oh, forgot to lower my hand.
Okay. The clerk will open the roll. Please vote as you wish. Let me just get to Alder Perez.
I'm sorry, Your Honor,
Alder Perez?
can you repeat what we're voting on? Because now I'm confused because of the muting.
Yeah, if the clerk would reread, what we're voting on is the main motion as amended. If the clerk could please restate the motion as amended.
Item 0478-20, the motion is to approve as amended. The amendment was to contract with 80% of the hires must be city residents.
Alder Perez, you are the first vote.
Yes.
Alder Peterson,
Yes.
Alder Tate,
Aye.
Alderwoman Glenn,
No.
Alder Santiago,
Aye.
Alder Mikma,
Aye.
Alder Levy,
Aye.
Alder Land,
Aye.
Alder Horton,
Aye.
Alder Lemke,
Aye.
Alder Jones,
Aye.
Alder Taft,
Aye.
Alder Young.
Aye.
That is 12 ayes and 1 no.
Okay, going back to the Finance Committee report. Alder Taft, do you have other items for separate consideration?
I do.
Please read the next item for separate consideration, please.
Okay. The next item for separate consideration is item 491-20. Communication sponsored by the chair on behalf of the city clerk requesting to waive formal bidding and enter into an agreement with Kane Communications for community outreach and election official training revolving around the August and November election. Recommendation of the committee was to approve waiving formal bidding and enter into an agreement with Kane Communications for outreach revolving around the August and November election. Funds are available from the Center for Tech and Civic Life Safe Elections grant in the amount not to exceed $120,000. Move to approve.
Okay, thank you. Is there a second on this item? If anyone would make a hand gesture to second the item. Alder Young has seconded the motion. Alder Taft, would you like to speak to the motion?
We had a pretty robust conversation about this item at the Finance and Personnel Committee meeting. Excellent questions were raised regarding so we wanted to have a representative from Kane Communications to speak at the meeting. That wasn't possible, about the success they had with the previous outreach efforts surrounding the COVID-19 items that we've been working with them on, and potential success rates, particularly with marginalized communities. So we were hoping to hear more from them this evening if possible about those items, but generally the recommendation we did approve, because of the time limitations and because of their experience with our community already, particularly with targeting communities that are vulnerable for voting. We approved this item.
Thank you, Alder Taft. Just so people do know, Kimberly Kane of Kane Communications is on the line. I don't know, Kimberly, if you're unmuted, if you can hear me right now.
I can hear you, Mayor, and I believe we have Morgan Burns from my team on as well.
Great. So I don't know if, Kimberly, if you could just spend, I know this is hard, but the hour is late, if you could spend just 60 seconds reminding people about your firm, your own residency here in the city of Racine, and then what I'd like to do is just open it up to questions that alders might have about the proposal before us today.
Sure. Thank you, Mayor, and thank you so much, members of the Common Council, for the opportunity to talk with you about Kane Communications Group and the opportunity to support you in this very important initiative, as well as the very important work that we did together related to raising awareness about COVID-19 and the impact COVID was having on our community at that time. Kane is a strategic public relations and marketing firm, and I'm proud to say that we were founded here in Racine in my basement. I'm a mom of 4, and starting Kane here in Racine gave me a fantastic opportunity working with companies here in the city of Racine to grow my business to the point where we've been able to hire quite a few people. 3 of them are Racine residents. So the majority of our work is working in government, health and human services. We also do a lot of work in the area of healthcare. And the work that we do in health and human services is primarily focused on raising awareness, increasing opportunities, and engaging individuals who are in lower socioeconomic levels and oftentimes marginalized, connecting them with important services that can change their lives. So today we have 12 employees, and again, 1/3 of them live here in the city of Racine.
Thank you very much. And then I'm just going to ask the clerk to put this proposal in the context of the larger grant that we received and the council approved, I believe, the meeting before last.
So this grant was actually the one from the Center of Tech and Civic Life. It was approved to be used specifically towards elections. It included hiring a communication firm. It includes everything from paying for the firm to billboards, radio ads, social media outreach, as well as redoing some of our election official training to become all virtual, so we can keep election officials up to date online as well. So this includes multiple facets to that one grant.
Thank you very much. And then with that, I will open it up to questions either for the clerk or for Kane Communications. I will start with the council president.
Thank you, Mr. Mayor. So one of the questions I proposed in committee, and yes, we advanced it, but not without some outstanding questions to be addressed. And I'm glad that the team from Kane Communications is on with us tonight. Thank you for being here. But one of the things that stood out in the initial coronavirus communications package, that there were still pockets of the community that were having difficulty being reached. And I want to know kind of, what your plans are, if awarded with this contract to reach those pockets that were not necessarily being resonated with the website, with the Facebook feeds, et cetera. And what steps are you plan on taking, whether that's subcontracting or otherwise, to reach those communities that were not easily accessible during the first round for the coronavirus outreach?
Kimberly?
Sure. Yeah, thank you very much for that question. And I think that's one of the most important parts of the work that we do is we begin with research to understand who those communities are and where they are. Our goal is to make sure we know exactly who we need to be connecting with. And then we build partnerships. So to your point, we may identify an individual that we could subcontract some of this work to. But I think a lot of the heavy lift is on our shoulders to build partnerships that help us build relationships with individuals in those communities. So in working on the COVID-19 communications work, one of the first steps we took was to create community conversations with individuals in representing the faith-based communities here in the city of Racine, and to begin building relationships with individuals who have connections in our Latinx community as well. So that's one of the most important parts of public relations, is identifying who those target audience members are, who the stakeholders are that we can build relationships with, who will pull us into their communities so we can communicate with them in their voice, with images that resonate with them, and images and words that they'll respond to.
Okay, thank you.
Thank you, Alder Tate. Alder Perez.
Thank you, Your Honor. I have two questions, basically. Why is this formal bidding being waived? And what does outreach entail?
I'll let the clerk address the waiver issue in terms of the timeliness and the sole sourcing of it. If the clerk could address that, that'd be great.
Although it may not seem like it, we're probably about 80 some odd, 90 some odd days away from the November election. By the time we went through a formal bidding process, it really wouldn't leave that much time for a communication firm to start working on the November outreach that we're really hoping to get accomplished through that grant fund.
Alder Peterson.
Yes, I got three questions for Ms. Kane, and then one or two concerns I'll voice afterwards.
Please proceed.
Okay. What are the measurable goals of this campaign? Will there be measurable goals? What are the vehicles or strategies you're going to use to meet these goals? Your email, mailing, social media, internet ads, etc., radio, billboards, and will we receive a report card afterwards on the success of the campaign?
Yeah, and Kimberly, I'm going to have the clerk address the first part of the Alder's questions there, and then ask you to add accordingly as you see fit. Clerk Coolidge?
So essentially the goals are created through the clerk's office. A lot of those goals revolve around voter registration and outreach, and increasing those goals within specific wards where we believe the voter registration is low. So we're really going to use some of our ward numbers and essentially some of the census numbers to determine which wards specifically need to be targeted to increase that registration rate. The hows are also determined through my office and the grant. We're focusing a lot around social media, although there are billboards, multiple things in English and in Spanish through the outreach. Not so much on the general mailer, and that's specific because the Election Commission is putting out an absentee mailer. So we're trying not to double dip into the same pools that are already being taken care of through funds elsewhere.
And then Kimberly, do you want to add to that at all?
Yeah, absolutely. And if you don't mind, I'd like to answer one of Alderman Perez's questions as well. He asked, what is formal outreach?
Yep, please go ahead.
So I can quickly answer that question first. So formal outreach, Alderman Perez, is identifying those individuals and those organizations that we want to target with our communications. So, you know, if there are individuals in certain areas of our community, as the city clerk mentioned, that we know tend not to vote at higher rates, or perhaps in the past have not returned absentee ballots. We want to begin building relationships with each of you to help us, you know, develop relationships in those communities. Or we might reach out to different organizations that have relationships or serve individuals in those communities. during the COVID-19 work that we were doing with the city of Racine, we reached out to Racine Unified School District, and that outreach led to our ability to create a youth advisory council. And we engaged that youth advisory council to give us ideas on how we could better connect with young people who at that time we understood were less likely to listen to some of the broader messages that were out there. So that's the kind of outreach we would want to do. And it's based on our understanding of who the target audience group is that we want to be connecting with. So Alderman Peterson, oh, go ahead.
No, please. I was just going to ask you to pivot to Alder Peterson's question. So please go right ahead.
Yes, yes. So I love these questions, Alderman Peterson, because they're really in line with the strategic work that we do. So jumping straight into creating tactics that might be a billboard or might be a social media campaign without setting measurable goals on the front end and without doing the research by understanding our target audience group on the front end is not an effective approach to achieving measurable outcomes. So we would work with the city clerk's office to, again, understand who the target audience is, to establish measurable goals that the city clerk's office agrees are the targets that you're going to hold us accountable to. And then using research, we will develop a strategic communications plan with strategies and with tactics that will help us engage those audiences and achieve the outcomes that we have set out to achieve. One of the nice things about social media and digital, and I've got Morgan, I hope, on the line here, is that we can measure a lot of what we're doing. And Morgan, you might talk to some of that. But in addition, we're developing materials, training materials, videos potentially as well, that are designed to deliver the messages that we need to be delivering through this campaign.
And Morgan, you're unmuted. If you have anything you want to add to that component of it, please proceed. Or maybe she's not there. Alder Peterson, you said you had a couple more questions?
Yes, just to follow up on that. I didn't hear whether or not we'll receive a report card. I'm looking, I don't know if the city clerk has a target going from 60% voter register vote, people that vote, or trying to get 65. What's the goal? You got to have a goal.
Yeah, absolutely. And so we'll work with the city clerk's office to understand what the city's goal is for us. And
I'm asking the city what their goal is. Thank you, Ms. Kane.
Clerk Coolidge?
I think the goal is going to be dependent on how many absentee ballot requests we have on file. Obviously, a lot of our focus wants to be on, okay, if you turned in an absentee ballot right now because of COVID, we want to increase that number that essentially are being counted and not rejected. So while I'd love to give you a certain percentage, I won't know the percentage until I see August results and then at least 90 days after November. Obviously, the goal is always 100% when it comes to elections, right? I'd hate to give you another number because I want everyone to come out and vote. So I think even increasing the number of registered voters, because we haven't had a census in 10 years, I'm not going to be able to give you a count of exactly how many city residents we have in the city. However, based on previous numbers, I would like to increase to somewhere around the lines that the top other 5 cities by population have. We right now are the lowest compared to all of the other communities, and I'd really like to increase that number to be along those percentages. So I'm working with Kane to come up with the contingent goals, but before we come up with the goals, we needed to have a contract in place so that we could work together to create those numbers.
Alder Peterson?
All right. Yes, that takes care of the questions. And once again, this is going back to the COVID contracts and no bid contracts in general. Once again, I'm not sure why other companies like Image Management, Corporate Management, other ones that I would assume could do the same stuff, and once again, local companies, why we haven't gone that direction. I appreciate Ms. Kane is a resident. She has 3 employees that are residents of the city as well and very active in the community. But I'm not a big fan of no bid contracts to begin with. And when they keep going to one firm, I got a little bit of an issue with that. I'm sure she does fantastic work. Like I said, nothing against her or her firm. Just the concept of no bid contracts going to the same company consecutively is an issue for me.
Thank you, Alder Peterson. Alder Glenn.
Great, thank you. I just have a few questions. What is going to be the position, during this outreach regarding remote voting, absentee voting versus in-person voting? Is this whole outreach to get people to absentee vote or just to get people to vote?
I'll defer your question to the clerk and maybe ask her to remind people what the overarching goals of the grant were in terms of people voting safely and other considerations.
So all of those things were outlined when we approved the initial grant as to what kind of outreach we're going to be doing. We are waiting along with all of the other big communities to make any plans before the November as to see how COVID either increases or doesn't increase. But this specific grant was towards getting out the vote as well as safely getting out the vote. So a lot of the messages will be focused on absentee, but also voting in general. How to request an absentee, what type of satellite voting do we have available, early voting, hours. Obviously, all of those things will be determined as we get a little bit closer so we can see what COVID does, but this grant will go towards all of the other efforts we put out throughout the city.
I noticed that you didn't, thank you, but I also noticed in that you didn't include the regards to getting a voter ID. Is that included in?
So requesting an absentee ballot requires you to have a photo ID on file unless you're indefinitely confined. So it would go along with the requirements to vote absentee. So it will include things like that when it comes to the outreach.
And then one last question, what are the steps, that we're going to be taking to ensure, like all of these messages for this outreach are going to be, really remain unbiased?
Alder Glenn, go ahead. Or I'm sorry, Clerk Coolidge, go ahead, respond.
That's okay. This is certainly one of the things that I hold near and dear to my heart with elections. All of the communications from Kane before they go out to the public will have to pass through myself particularly. So therefore, they're not allowed to have anything on them that's partisan at all. So we're going to be making sure that those messages stay clear to everyone and they're exactly what everyone needs to do. So that's part of something my office already takes very seriously and we will continue to take very seriously.
Oh, okay, great. So that's why I'm just wondering why, if you want to keep everything basically, unbiased, nonpartisan, is there a reason why I was not included to be a poll worker?
Point of order, we're getting away from the item. Point of order.
Yeah, if we want to get back to the topic, I'm sure, Alder Glenn, the clerk can have a conversation with you about your desire to be a poll worker. Right now, what we have before us is an item on a communications contract.
Can I get you to also be included in that? Because my email was sent to you also.
I would be happy to respond, but I know it's not in line with the item, but I'll be happy to email you back if you have any questions about that.
Okay, thank you.
Alder Perez.
Yeah, thank you, Your Honor. I have the similar concerns to Alder Peterson, but I also am curious as to why there's specific outreach instead of community-wide outreach. I'm bothered by the fact that you want to target a specific group of people instead of the whole community. I believe that voting is one of those rights that, as an American citizen, you must exercise. And if you're an American citizen, I encourage you to vote, absolutely. But I'm wondering, I would say, hey, Tara, let's reach out to everybody in the community and encourage them to vote. But here, what I'm hearing is this is only going to be targeted to a certain community, and I'm bothered by that. Can you explain the details of that, please?
Clerk Coolidge.
Sure. So certainly when we say targeted, we're talking about the goals to be able to prove what the outreach did or didn't do. If we're doing a social media outreach, it's going to be to the whole city. If we're posting it to the clerk's Instagram, to the Facebook page, if we're doing things like that, a radio ad, a billboard, although that might be specific to an area, certainly doesn't just include the people that live there. It includes the people that commute through that area. So that's where we're looking for a lot of Kane's expertise. It's not that a specific group is being targeted. It's the goals that we need overall. We're going to have to base off targeted areas in order to come up with a realistic goal number-wise for Kane to be able to reach.
Alder Perez?
Yeah, that sounds really good, Ms. Coolidge, but I'm still concerned that maybe the wording that we're using is not really conveying what you want to do. And again, please be conscious of the fact that we want to reach the whole community and not just a specific group of people. I would be really bothered by that. Okay, just moving forward. Thank you.
Thank you, Alder Perez. Is there any other discussion on this item? Alder Peterson.
Yes, being that we didn't hear anything in regards to how successful the previous campaigns from Kane Communications were. So I'd like to make an amendment that the Common Council will receive a report card as of the success of the Get Out the Vote program.
I guess, I mean, do you want to amend that to this component of the plan, Alder Peterson, or do you want the clerk to provide that information to the council post-election on all the efforts that are in the $940,000 grants that we received?
This specific, because this, as far as I know, this is the only one I voted on for that, isn't it?
It is. It is.
No, there's other
And,
I'm sorry, there are other items today, but.
Right. So it's just specific.
Okay.
It's just motion specific.
Clerk Coolidge?
Just out of my own curiosity, just so I have it right. So I know that we don't have a report card included in the current grant money in the funds that we have received. So you're looking for my office to provide some sort of, hey, this was the registered number of voters before versus this is the number of registered voters now. I don't know that we're going to be able to separate it out specifically by what Kane Communication Group did as compared to some of the other initiatives we have throughout the city as well.
Okay, so as a result of this $120,000, there is nothing that's measurable.
There are measurable components to it, but measurable specific to Kane versus measurable, you know, considering some of the other items even passing through tonight. I don't know how we would specifically be able to measure those.
All right, I cancel the motion.
Okay, thank you. Alder Glenn?
I hear a lot about this outreach is, you know, via social media. We do have a public access channel, Car 25. Is there any Kane Communications, that would be an outreach to anybody? We've already voted, you know, for that to get back up and running. Does she feel?
Point of order.
Yeah, I mean, Alder Glenn, Kane Communication isn't going to be able to answer questions about the status of Car 25. That's another item. But if you want to make the general point about public access and other venues, go ahead.
Yeah, that's what I'm trying to make. You know, it's social media. Not a lot. You wouldn't be surprised there's not a lot of people out there on social media. And what are the other ways? And one of the ways I've thought Car 25 would be a great way for people to continuously see the outreach we're trying to do to get voters out registered and voting.
Kimberly, you want to talk about maybe some of the tactics or different media that you might use in this process?
Sure. I think Alderwoman Glenn is thinking like a communicator. And I think we need to know what all of the channels are that we have available to us. I used to serve on the Car 25 commission. way back when. So it's great to hear that that will be up and running again. But that may be one of the strategies that we end up using. I think the research work that we do on the front end, working with the city clerk, will help us understand the channels that are available, because we'll understand the target audience groups that we want to reach. So I think we want to be very open-minded to what channels we can use. And you're right, social media is not the only approach. Not everybody is on social media. So there may be direct mail. There may be community conversations that we hold virtually with individuals or organizations to help us get the word out. But the research that we do on the front end will help us identify what the right strategies and the right tactics are for us to use.
Thank you very much for that clarification. Nobody else in the queue. I'm going to ask the clerk to reread the item before us. And then I will, when I unmute your microphone, please vote as you wish. Clerk Coolidge, could you please read the item?
Sure, it's item 0491-20. It's a motion to approve. Alder Perez unmuted.
Sorry.
Alder Perez?
Yes.
Alder Peterson?
No.
Alder Tate?
Aye.
Alderwoman Glenn?
Sorry, say it one more time.
Alderwoman Glenn?
No.
Alder Santiago?
Aye.
Alder Mikma?
Yes.
Alder Levy?
Aye.
Alder Land?
Yes.
Alder Lemke?
Abstain.
Alder Horton?
Aye.
Alder Jones?
Yay.
Alder Taft?
Yes.
Alder Young?
Aye.
Alder Taft, do you have any other items for separate consideration?
Not that I am aware of.
Then please proceed with your report.
Fantastic. All right, scrolling back up. Okay, first item, item 15-20, communication, sponsored by Alder Levy, Alder Tate, the second, Alder Jones, and Alder Young, requesting to reduce the interest rate residents would pay for city loan on assessed projects. Recommendation of the Finance and Personnel Committee is to adopt the ordinance as attached and written. Fiscal note, the 2020 interest rate is 6%. Beginning in 2020, the interest rate would be 4.5%. So next item is item 422-20, a communications for Young, and a request by Matthew G. Sadowski, Interim Executive Director of the Community Development Authority, or CDA, seeking permission to prepare and execute a loan through the Business Lending Partners for up to $100,000 of the City of Racine EPA Brownfield Cleanup Revolving Loan Fund, BCRLF, for the purpose of supplementing an EPA Brownfield Cleanup Grant of the CDA intended to fund the removal of contaminants from the CDA property at 1425 North Memorial Drive. The recommendation of the Community Development Authority on July 9th is that the request by the interim or executive director of the CDA to execute a loan through the Business Lending Partnership for up to $100,000 of the City of Racine's EPA Brownfield Cleanup Revolving Loan Fund for the purpose of supplementing an EPA Brownfield Cleanup Grant of the CDA for the property at 1425 North Memorial Drive be approved, subject to terms and conditions listed in CDA Resolution 20-3. Further, that the interim executive director and or chairman of the CDA, mayor, city clerk, or their designee be authorized to execute loan documents to facilitate the loan. The recommendation of the Finance and Personnel Committee is that the request by the interim executive director of the CDA to execute a loan through the business lending partnerships for up to $100,000 of the City of Racine's EPA Brownfield Cleanup Revolving Loan Fund for the property that has been mentioned, be approved, subject to the terms and conditions listed to CDA Resolution 20-3. Also approve associated 20% of city 20% city match of up to $20,000. The fiscal note is that the BCRLF loan of up to $100,000 will be made from a grant received from the Environmental Protection Agency. Racine County Economic Development Corporation Business Lending Partners will serve as the loan servicer. A 20% city match is required. City match of up to $20,000 is available in 95060-52200 Brownsfield Contracted Services. Next item is item 445-20, communication sponsored by the chair on behalf of the city clerk, requesting to apply and accept the Wisconsin Election Commission CARES subgrant to be used for August and November 2020 election cycle. Grant control number 00332. The recommendation of the Finance and Personnel Committee is to approve and that the mayor and city clerk be authorized to apply and accept the Wisconsin Election Commission CARES subgrant to be used for August and November 2020 election cycle. Fiscal note, the amount to be determined by the Wisconsin Election Commission equal to $200 plus $1.10 per registered voter in the city of Racine as of June 1st, 2020. No city match is required. Next item is item 480-20, communication sponsored by Alder Lemke on behalf of the Public Health Administrator, requesting that the mayor and city clerk enter into a contract agreement and to accept funding in the amount of $62,397 from the State of Wisconsin Department of Health Services, Division of Public Health for COVID-19. The funds will be used for public health crisis emergency response and for the continuation of emergency preparedness efforts for the city of Racine. Recommendation of the Finance and Personnel Committee is that the mayor and city clerk enter into a contract agreement and accept funding in the amount of $62,000 or $62,397 from the State of Wisconsin Department of Health Services. No city match is required. Next item is item 481-20, communication sponsored by Alder Lemke on behalf of the Public Health Administrator, requesting permission for the mayor and city clerk to enter into a contract agreement and to accept funding in the total amount of $870,860 from the State of Wisconsin Department of Health Services, Division of Public Health for the following programs: ELC COVID-19, epidemiology and laboratory capacity, $24,200. The funds will be used to rapidly establish and monitor key activities related to COVID-19 in the areas of epidemiology, laboratory, and informatics. The contract period is from February 1st, 2020 through September 30th, 2021. COVID-19 test coordinator, in the amount of $127,800. The funds will be used to support staffing and resources to convene partners and coordinate or support local testing efforts to quickly identify new cases of disease and investigate and contain outbreaks. COVID-19 plan, $30,000. The funds will be used to update and support local public health preparedness pandemic plans for COVID-19 to match Wisconsin's statewide box-it-in strategy consisting of testing, isolation, quarantine, and contact. COVID-19 contact tracing, in the amount of $688,860. The funds will be used to conduct disease investigations and contact tracing for a wide variety of communicable diseases. The contract period for these items is March 1st, 2020 through December 31st, 2020. Recommendation of the Finance and Personnel Committee is that permission be granted to the mayor and city clerk to enter into a contract agreement and accept funding in the total amount of $870,860 from the State of Wisconsin Department of Health Services, Division of Public Health for the programs listed above. Fiscal note, no city match is required. All right, next item is item 482-20, communication by Alder Lemke on behalf of the Public Health Administrator, requesting permission from mayor and city clerk to enter into a grant agreement and accept funding from the Wisconsin Department of Natural Resources in the amount of $28,000. The funds will be used to monitor Wisconsin DNR designated public beaches in southeast Wisconsin, Racine, Kenosha, and Milwaukee counties in accordance with Federal Beach Act requirements. The recommendation is that permission be granted to accept the funding from the Wisconsin DNR in the amount of $28,000. Fiscal note, no city match is required. Next item is item 483-20, communication sponsored by Alder Lemke on behalf of the Public Health Administrator, requesting permission from the mayor and city clerk to enter into a contract agreement and to accept funding in the amount of $21,000 from the State of Wisconsin Department of Health Services, Division of Public Health for HIV prevention. The funds will be used for HIV prevention and integrative surveillance programs. recommendation is that permission be granted to enter into a contract agreement and to accept funding in the amount of $21,000 from the State of Wisconsin Department of Health Services, Division of Public Health for HIV prevention. No city match is required. Next item is item 482-20, communication sponsored by Alder Lemke on behalf of the Public Health Administrator, requesting for the mayor and city clerk to enter into a contract agreement and to accept funding in the amount of $8,800 from the State of Wisconsin Department of Health Services, Division of Public Health for bioterrorism preparedness. The funds will be used to build and strengthen Wisconsin's ability to respond effectively to public health threats and for the continuation of emergency preparedness efforts for the city of Racine. Recommendation is that authorization be granted to enter into a contract agreement and to accept funding in the amount of $8,800 from the State of Wisconsin Department of Health Services. No city match is required. Okay. Item 486-20, communication from Mayor Mason presenting a request on behalf of the City of Racine Sustainability and Conservation Coordinator to amend the solar ground lease agreement approved by the Common Council on May 5th, 2020. Under item 0243-20 with Wisconsin Electric Power Company, a Wisconsin corporation, doing business as We Energies. The amendment would modify the area used for the City of Racine's participation in We Energies Solar Now program and result in a 600 kilowatt solar system being installed on 3.06 acres at Olson Prairie Park. The recommendation is that the mayor and city clerk are authorized and directed to enter into an amendment into the solar ground lease agreement with Wisconsin Electric Power Company, a Wisconsin corporation, doing business as We Energies. In fiscal note, this amendment will not affect the revenue anticipated to be received by the City of Racine. Next item is item 489-20, communication by the chair on behalf of the Assistant Finance Director, submitting the presentation of fourth quarter 2019 and the first quarter 2020 fiscal results and the March 2020 investment schedule. Recommendation of the Finance and Personnel Committee is to receive and file. Let's see. The next item is item 492-20, communication sponsored by the chair on behalf of the city clerk, requesting to waive formal bidding, sole source, and enter into an agreement with Burlington RV to purchase a mobile voting precinct. Recommendation is to approve waiving formal bidding, sole source, and enter into an agreement with Burlington RV to purchase a mobile voting precinct. Funds are available from the Center of Tech and Civic Life Safe Elections Grant, not to exceed $250,000. Next item is item 494-20, communication by the chair on behalf of the city clerk, requesting to waive formal bidding and purchase 40 Badger books from Paragon Development Systems Incorporated. Recommendation is to approve waiving formal bidding and purchase 40 Badger books from Paragon Development Systems. Note fiscal note, funds are available from the Center for Tech and Civic Life Safe Elections Grant, not to exceed $80,000. And this concludes the Finance and Personnel report for this evening.
Alder Perez, did you have a question or an item you wanted for separate consideration?
Yes, sir. I have a question on 3 items, not necessarily separate consideration. I'd just like some more information on. Is that okay?
Please state your question, sir.
Okay, on 0483-20, it talks about integrated surveillance programs. When it's talking about HIV, what does that mean?
I would usually refer your question to, oh, she's still there. Wow. God bless you, Dottie K. Barasak. She's still there.
Yes,
Dottie K, could you address the Alder's question?
Yeah, it's our partner notification partner referral program to the state of Wisconsin. It's a continuing grant, and for those individuals that have been identified as HIV positive, we have interaction with them, and then we do the contact tracing with the relationships or individuals they've been involved with.
And that's what integrated surveillance programs means?
Yeah.
Okay. Then I have another question for the solar power 0486-20. It's a lease agreement over an extended period of time. How often does that get reviewed?
I am going to, I don't know if Attorney Letney knows the answer to that question, or if Kathleen Fisher knows the terms of that. Do either of you know the answer to that question before us?
Yeah, I probably can answer. What was your specific question again, Alderman? I'm sorry.
I think the question was the length of the lease. Is that correct, Alder?
Yeah, how often does that get reviewed? Because it seems like an extended period of time and prices go up and down and the need for solar power may change. How often do you look at the agreement?
Well, this is a brand new agreement the council approved in May, and to put solar arrays at the Olson Prairie Park. And when We Energy's contractor was going to actually install the solar arrays, they discovered that there was an unrecorded storm sewer easement owned by the Village of Mount Pleasant that went across the property. So they had to rearrange the arrays from the way they were presented to the council, and it also expanded the area they needed by about 1/10 of an acre. I mean, a fairly small piece. It's still approximately 3 acres. So really nothing changed except the diagram of the solar array and the specific area of Olson Prairie Park. So this lease, as I recall, is 20 years, and it's brand new, so it hasn't been, I mean, there's no experience with it, and there was no plan to readdress it before the end of that period of time.
Does the lease itself permit reevaluation if there's an issue somewhere along the line?
Attorney Letney?
Yeah, sorry, it's been a couple of weeks since I looked at this lease. The term ends, I'm sorry, I said 20 years, it's 30 years.
30 years, yeah.
Yeah, then we've guaranteed they can stay there for that long unless We Energies decides they want to be done. So that's really the way this lease was approved when the council approved it 4 months ago.
Okay. Does that also leave us the ability to revisit the lease if there's an issue somewhere along the line?
Well, if there's some circumstance that makes it impossible or difficult to comply with the lease terms of either party, there's always ways to go back and do that. But the assumption is, because of what it's going to be used for, it'll stay in place as is for the entire term.
Okay. And the final question, item 049220, recommendation for an RV purchase from Burlington RV, again, single source without going out. What was the reason for that? No waiving formal bidding, sole source to purchase a mobile voting precinct. And I don't remember being party to that discussion, and I have questions about its security because, voting is very important to all of us, and was wondering twofold. Why is it sole source waive formal bidding, and what are the aspects of the mobile voting precinct, and how does that relate to security?
I'll ask the clerk to answer your question, Alder Perez. Clerk Coolidge?
So the reason for the sole source is actually I've been working with the purchasing agent, and we accepted the grant to be used towards the August and November elections. So we're hoping to order it, A, in time, which they take a long time to do, but B, also between myself and the purchasing agent, we found 2 companies who were able to do this. One was Burlington RV. The other was a company out in North Carolina, excuse me, because I forget the name of the company at the moment. So we did reach out to both of those companies. We did, try to see who had the lower price. We also got a few recommendations for Burlington RV because they've also built our command units, not only for the PD, but also for the fire company. Also maintenance on those vehicles. Burlington RV is close, and if something was to come up, we have the capability to drive right there. And they do have a full maintenance garage as compared to the place in North Carolina. Does that answer your question about the sole source? And then
Yeah, that's excellent. Now,
okay.
what is going to entail a mobile voting precinct, and how do you secure it?
I'm glad you're asking these questions because this is fun. Even though it's late at night, I apologize. So a mobile voting precinct is going to be essentially what we use for the early satellite voting. Right now we go up, and I'm glad you asked the security question because it's actually a lot more secure to have our own locks, our own keys, our own security seals essentially on the ballots. Now, no ballots will be allowed to be left in the mobile voting precinct. It'll always have to come back to City Hall and drop off all of those extremely secure ballots, essentially. But it will be able to rotate throughout places throughout the whole entire city much easily, and we'd be able to hire less staff and reach more of the city. So my hope in November is that it would have scheduled days and times at different locations throughout the city so that we could offer more satellite voting citywide.
So its sole purpose is for satellite voting?
Correct.
And so
We
you
would
don't
also be
plan on
holding
using it-
registration drives through it, but the sole purpose would be satellite voting.
So there's no intent to use it during the regular election day?
No, satellite voting is actually right now it's for 2 weeks before the election, although the law has changed multiple times on me this year. So it essentially would move around every day, possibly even multiple locations in one day.
How many people man this?
So it's required at each polling location to have at least 3 by state law. I would probably at least always have 5 if at all possible.
Oh, cool. All right, thank you.
You're welcome.
Thank you. With no objections, we will refer the remainder of the Finance and Personnel Committee items to the consent agenda. We will now then move on to Alder Jones and the Public Works and Services Committee. Alder Jones, do you have any items for separate consideration?
I have one item and not at this time, no requests for separate consideration.
Okay. I do believe that Alder Young may want separate consideration on this item. Alder Young?
Yeah, I mean, I would be fine with this being on the consent agenda, but I do have a couple questions for the commissioner.
Then if we could ask the chair to read the item first, and then we can address your question then. Alder Jones?
Thank you, Mayor Mason. Item 0263-20, communication sponsored by the chair on behalf of Commissioner of Public Works, City Engineer, submitting a revised state municipal agreement for state project ID 2440-09-00/70, Washington Avenue, Roosevelt Avenue to West Boulevard. Recommendation to approve, authorize, and direct the Commissioner of Public Works City Engineer to sign the revised state municipal agreement for state project ID 2440-09-0070, Washington Avenue, Roosevelt Avenue, the West Boulevard project. The estimated total cost of the project is $14,707,300, with the city share being $1,011,100, 25% plus balance, and the federal state share being $13,766,200, 75%. Physical note, funding for the city share is available in ORT Object 45040-57500, State Highway 20 West to Roosevelt. Move to approve.
Okay, there's a motion to approve. Alder Young, would you like to, or would somebody else like to second the motion?
Second.
A second by Alder Tate, I believe, if I heard correctly. Alder Young, you had a question for the commissioner.
Yes, so I am very cognizant that it is 10:38 at night, and so I just want to express my appreciation for Commissioner Rooney for staying this late hour to answer some questions that I think are pretty important regarding the future of this project. So understanding the timeline is going to be critical, I think, to best approach this. So there were really 6 questions that through my conversations with the business community and neighbors that came up. So what I'm going to do is I'm going to read through the questions and then explain why I really am supportive of the project and then give the commissioner an opportunity to respond. So the first question is, what is the timeline for the project? That's number 1. Number 2 is what is its relationship to the utility projects occurring on Highway 20, and how are we aligning these projects to create efficiency? Number 3 is what's the role of the city to ensure that this project gets done in a timely manner? Number 4 is what can the city do to limit the short-term damage this type of project may have on area businesses, such as signage for businesses and parking? Next, what improvements are being made in the traffic pattern and pedestrian infrastructure that benefit the neighborhood in the long term? Because I think that that's the most exciting part of the project. And then finally, what is the longevity of this new infrastructure? How many years will we have this quality infrastructure before we have to revisit the corridor for construction? So understanding that it is late, I wanted to lay out all the questions in the beginning and give the commissioner an opportunity to explain the project.
Commissioner Rooney. Oh, hang on, Commissioner Rooney, let me unmute you. Commissioner Rooney.
I'll answer these questions, Alder Young. I'll kind of rephrase them. The first question was as to the timeline. So the project will be let by the state of Wisconsin Department of Transportation in November of this year. Let means they'll open bids on it. They will award it sometime after that. It will be contingent upon weather when the project begins. So with the November let, the contract will be signed, within a few months, both by the contractor and the governor. And it really may depend on whether they get a break in weather. Conservatively speaking, I could see the contractor starting sometime in mid to late March. A project of this size is scheduled to go through the middle of November. So it's probably about 7-8 month construction time frame. Does that answer question number 1?
It does. Thank you.
I think your second question was relationship to the utility companies. So utility coordination is an integral part of any state DOT project. All utilities are brought in for discussion on what infrastructure that they have, what they want to replace or upsize or upgrade or whatever the case may be. And that is coordinated with Wisconsin DOT. So all those changes can be made. So when the Wisconsin DOT's contractor shows up on the job, none of that impacts construction schedule. So they want all utilities either relocated or relocated or replaced prior to start of construction. So the DOT handles the utility coordination portion with all utilities that have franchise rights to be in the public right-of-way. You probably noticed the Racine Water Department showed up earlier this week to start. You'll be seeing the gas company there as well later this year doing some work as well. All this work gets coordinated, so like I said, it doesn't impact the road builder's timeline. Any more questions on that particular item?
No, that's perfect. Thank you.
I think your third question was role by the city to ensure that the project gets done on time. Well, we definitely have a role. We'll be part and parcel to the project in every facet of it, just like we always have been doing in the last 20 years that I've been with the Department of Public Works. We take an active role in the weekly meetings. There are meetings that are set up to ensure that the contractor is on schedule. The DOT has got very, very stiff penalties for liquidated damages, particularly on a contract this large. The liquidated damages go up proportionally to the size of the contract, so they amount to thousands of dollars a day on a contract this size. I don't have the exact number. We're pretty good at making sure these projects are designed and staged in the construction documents. They can be completed in the time. Can be completed in the time that we that the state allocates in the contract there.
and we're adamant that the contractors stick to it. I've maybe always heard some comparisons of various projects in the city that are done with state contractors and then get somehow referenced back to County Trunk Highway MM and the problems they had 2 years ago. Rest assured that was a state project, but it was part of the county's capital improvement program. We haven't had that experience. We have confidence that we could keep this project on schedule, and that's why we participate like we do. Does that answer your question as to the role by the city?
It does, Commissioner. Thank you.
And I think your next question has something to do with what are we doing to try to minimize short-term damage to businesses? Is that correct?
Correct.
Okay. Well, the first thing is, and this is part of why we go through the public involvement meeting process, which we held over the last several years, and we created a Citizens Advisory Committee, is trying to get input on how to better serve the area that's being impacted by construction. One of the things that was loud and clear to us was to build the project under traffic conditions, and to build the project under traffic conditions with the traffic coming into the city that is in towards the residential properties, in towards the businesses. Much like we've done this year on Durand Avenue, we're always maintaining eastbound traffic. And when we were building Douglas Avenue 2 years ago, we were always maintaining southbound traffic. That was what we heard loud and clear through public involvement, through the Citizens Advisory Committee. It's important to get our customers to us as quickly and as efficiently as you can. Let them stop, do their shopping, they'll find their way home. So we did that. The next thing is also to make sure that side streets have access during the project at all times. And there are obvious closures to side streets, so much like we're doing on Highway 11 this year, we did on Douglas Avenue 2 years ago, is we staged the intersections so we don't have consecutive intersections in a row closed, so we'll stagger those. So there's always cross-traffic access to the corridor. We cannot maintain parking on this corridor during the project, which we know is difficult, but it's just unfortunately the width of the road. We can maintain a lane of traffic, but we did work with both the public and the Citizens Advisory Committee to make sure that they had access to all the off-street parking facilities that exist in West Racine. And then during construction, we will hold a public involvement meeting prior to that, probably sometime, I would guess, in late January, early February, usually 4 to 6 weeks prior to when the work actually begins. And we'll hold another that'll be specifically geared towards businesses. And that's where we want input on, do you need signage put up to direct people to your businesses? And there are simple agreements that can be executed whereby the business owner can provide the sign, and WSDOT will allow the contractor to affix it to their traffic control signs. And we've done that on pretty much every highway project we've done with the DOT. I think that answers most of those concerns. I don't know if there are any others related to that question.
No, that's exact. You hit the nail on the head. Thank you.
And then your fifth question, that was related to pedestrian safety, and particularly like in West Racine Business District?
Yeah, the general infrastructure improvements with bump outs and pedestrian
Sure.
bicycle infrastructure. Correct.
All right. Well, thankfully, the city clerk put one of the slides up that we use during public involvement meetings, and these are also the concepts that were also approved by the Citizens Advisory Committee, which was largely built out of property owners, business owners, residents along the corridor, from as far west as Walgreens all the way to the dialysis center. So it was made up with a pretty diverse group of people that kind of told us what they were interested in, particularly as it relates to West Racine. A few things that were very consistent from public involvement and from the Citizen Advisory Committee was to try to get the pedestrians to have a safer feeling when they're in West Racine shopping. As you know, right now, for eastbound traffic, there's a time of day where you allow 2 lanes to come in. So one of the live lanes is right along the curb. We analyze the traffic volumes. We don't need to provide 2 lanes in the eastbound direction, even during the peak hour. 1 lane is sufficient. So what we're going to do there is move a live lane completely away from the curb. What we're also going to be able to provide within the existing width of the right-of-way is a designated bicycle lane in each direction, which again was important to the public and the Citizen Advisory Committee because, bicyclists, are our customers as well too. In addition to that, we're going to be providing a parking lane there. So this level of having the sidewalk, a parking lane, a bicycle lane provides a greater buffer for those pedestrians, that even the sidewalk can be widened, believe it or not, in this typical section that we're going to be building in these 2 blocks in West Racine. So they were very happy with that. In addition, what they also wanted to see is they wanted to see bump outs put in there. There's a lot of controversy and concerns about bump outs. Some people love them, some people can't stand them. We wanted to make sure this is what West Racine wanted. We've heard about some of the issues, going back to the Main Street project. They might have gobbled up too much parking. They were too long. We went through options. We gave them, like you see, option 1, option 2. Do you want very, very, small bump outs that minimize parking loss, or do you want some longer ones that we can install streetscape amenities in? Like the option 2 provides that extra room for streetscape, but it does come at a cost of maybe losing a space or 2 on each side of the street. So what was most important to them was that bump out helps create friction on the corridor, helps create some type of traffic calming. When you bring those curbs in, it's going to slow the traffic down. They're really going to be negotiating then 1 lane in each direction and curb right on each side where the pedestrians are going to cross. That also minimizes the crossing time for pedestrians, particularly elderly pedestrians. The shorter the crossing is, the more comfort that we can provide. So these are things that were very important to them. We did discuss with them there would be some parking loss associated with those. I think one of the other slides, maybe slide 16, if I'm not mistaken, actually shows, the net parking loss based on this in these blocks here. So it looks like, they're losing 2 on each side of the street, at the exception of the southwesternmost block side there. They're losing 3, but they were like, we've got plenty of off-street parking in the back, and that wasn't really a big concern of them. I think the slide before that, we were showing the minimal bump outs, and I think that actually had less of a parking lot. These are all things we demonstrated to the Citizens Advisory Committee and the public at the public involvement meetings, and they were okay with that. So, that's that trade-off that they're making, and it's about making choices and what's best, and that's why we hold public involvement, and that's why we formed the Citizen Advisory Committee. So I think those are the big things that we're trying to do to improve pedestrian safety, particularly in West Racine, with the installation of those bump outs. And I hope that answers your question.
It does. Thank you, Commissioner. And I do really appreciate your leadership on this project, as this especially is going to improve multimodal transportation in West Racine, and also I think attract private investment because of these type of infrastructure improvements. And I do appreciate the commitment to public involvement. I know a year ago, there were conversations at Wilson's Funeral Home with the West Racine Alliance, getting people engaged in participating in these conversations. So I want to thank you for your leadership and making sure that we can do this project with the DOT covering most of the costs. And I appreciate it. Thank you.
Yeah, and I think your last question was about what kind of life expectancy can we see out of this improvement. And this is generally an improvement that should last at least 30 years with minimal maintenance, So at some point in time, it does require some pavement maintenance, and, maybe it'll have to be resurfaced, 40 years from now, but this would be a really good investment that will last decades to come on one of our main corridors into the city of Racine.
Perfect. Thank you.
Alder Glenn.
I have no questions. I just have a little comment for the alderman of the 9th District. with the construction going on here down Highway 11 through my district, we did set up a meeting 2 weeks, I think, before construction started. Mr. Rooney did set that up. A lot of people came, really got to see what was going on, and it helped with a lot of the questions with the people along Highway 11 and traveling through. That will save you a lot of questions, and I just recommend that you do set up a meeting 2 weeks. Ours was 2 weeks before, and it helped with a lot of the questions. And I'll tell you, Highway 11 is going smoothly in our eyes, and that's all I wanted to say.
Well, I appreciate that, Alder Glenn. Thank you.
Thank you, Alder Glenn. Is there any other discussion on this item? Seeing none, a motion and a second has been made. When the clerk calls your name, please vote as you wish.
Alder Perez?
Yes.
Alder Peterson?
Yes.
Alder Tate?
Aye.
Alder Tate? Thank you. Alderwoman Glenn?
Aye.
Alder Santiago?
Aye.
Alder Mikna?
Aye.
Alder Levy?
Aye.
Alder Lamb?
Yes.
Alder Horton?
Aye.
Alder Lemke?
Aye.
Alder Jones? Alder Jones?
Aye.
Alder Taft?
Aye.
Alder Young?
Aye.
13 ayes, 0 noes.
All right. The last committee report is the Planning, Heritage and Design Commission. Alder Young, do you have any items for separate consideration?
Not at this time, Mr. Mayor.
Please read your report.
Our one item is item 218-20, request by Dominion Properties authorized agent Main Attraction LLC seeking conditional use permit to operate a hotel motel with possible extended stay, a request for a certificate of appropriateness, and a request for approval of exterior changes at 500 Main Street. Recommendation of the Planning, Heritage, and Design Commission is that it be approved subject to conditions A through H.
Without objection, this item will be placed on the consent agenda. This then moves us on to the consent agenda. At this time, I would entertain a motion to approve the consent agenda. Alder Tate.
Move to approve.
Is there a second?
Second.
Seconded by Alder Horton. I'm going to unmute everybody real quick here. All those in favor of the consent agenda, please say aye.
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 Opposed? Motion carries. We are now to the portion of the agenda for announcements. Just as a reminder, announcements are limited to recognition of city residents and employees, memorials, non-political community events. Discussion of matters related to governmental business is prohibited. Are there announcements at this time? Alder Perez.
Thank you, Your Honor. I had the pleasure a couple of days ago to come into contact with a couple of our public works garbage men. As I was putting some bulky item out on the road, they were quick, kind. They were like, "No problem, man. I got this. Don't worry about it." I was so impressed that I sent a letter of commendation to John Rooney, and from there, I guess I sent it to their bosses. But they were sweating. They were smelly. I mean, you know, and they were still friendly, and they were still doing their work, and they did an amazing job. And I'm very proud of them. I'm very proud that they work for the city and really making us look good. They're doing a great job out there.
Thank you so much. Alder Jones.
Thank you, Mayor Mason. I would just like to invite everyone to share in a fundraiser with the St. Paul Missionary Baptist Church. We're raffling off a 2019 Ford Fiesta this coming Sunday at 3 p.m. If anyone would like to purchase a ticket, they can call the church office at 632-1467, or you can contact myself. Thank you.
Alder Tate.
Thank you, Mr. Mayor. I just want to wish my older sister happy 40th birthday on August 1st. Normally, I wouldn't say someone's age, but because I'm a younger brother, I'm going to do it. So, yeah, wish my sister a happy birthday. She turned 40 this past Saturday, August 1st. So, happy birthday, Rebecca.
All right. Thank you so much for that, Alder Tate. I just want to give a shout out to Alder Taft and the Parks and Rec staff for the rededication of the Davies Park and Community Garden. It was a lovely event and was a great demonstration of community nonprofits and local groups really embracing their local park and programming it with a dog park and a community garden and the things that they wanted to see to make it a meaningful park to them and their community. So it was a great event. Thank you to everyone involved in that, and a special shout out to, again, Alder Taft and the Parks, Rec, and Cultural Services staff who were so integral, and to the Davies family who showed up to represent the Owen Davies Park and its namesake and his vision for making it a community space. So congratulations to all of them. With that, I would entertain a motion to adjourn, Alder Tate.
Move to adjourn.
Is there a second? All those in favor, please say aye.
Aye.
Opposed? We are adjourned. Thanks, everyone. Have a great day.
Thank you. Good night, everybody.
Stay safe.